Okay, very good afternoon to everyone. Um I'm Dr. Divya Gupta, the Periodontics faculty at DBMCI MDS. And as from Perio, the recall questions which I received. Very good afternoon to everyone. Uh, the recall questions which I received were approximately 13 to 14 questions, I assume, were from Perio, and nearly 12 questions, 11 to 12 questions, we have recalled very nicely. Still, if you all feel that there are some questions which were not like the way we have written it, you can always tell us in the comment box. Also, if you feel that some options, there are some questions in which all the options have not been mentioned. So guys, just let us know what were the options according to you and what are the questions came from periodontics. Overall, the periodontics paper was relatively like not very difficult, and two to three application based questions were asked, plus there were many questions from the topics which we have already covered. Approximately 95% of the questions were from the topics which we have covered either in our recorded sessions, live sessions, in our PYQ sessions. Okay, so with that said, let us start our session for today. So the first question was, a patient who brushes twice daily complains of bad breath. Her oral hygiene is fair and she has undergone treatment for the same 1 month back. Organoleptic score is 0. Tongue coat and tooth coat score was 1. There was no caries. What is the condition known as? So the options were: option number A, pseudohalitosis; option number B, halitophobia; option number C, intraoral halitosis; and option number D, extraoral halitosis. So in this question, guys, we can clearly negate out C and D, which is intraoral halitosis and extraoral halitosis. Right. The confusion arises between two options, which is pseudohalitosis and halitophobia. Both of them are like nearly same conditions with very few, there is a thin line which is different between the two. In pseudo halitosis, the patient feels that she or he is having bad breath, right? Even though the oral hygiene is good, there is not much deposits, and in this question they have said that she underwent scaling over like 1 month back, right? In halitophobia, the condition is the patient is continuously anxious, and for that, and the condition is at that level that they need some psychiatric treatment also. So, if it would have been halitophobia, they would have mentioned something regarding like psychiatric condition, any psychiatric treatment, or the patient is very anxious about her breath. That such thing has not been mentioned in the question. If the same question with the same wordings was there, the answer to this question would be pseudo halitosis. Okay, it would be pseudo halitosis. Yes. Now, the next question: what does the cross denote in the below image? What does the cross denote in the below image? Here, this is the area which has been crossed. So they are asking about this. Now we know that this region here, it is your attached gingiva. The above region is free gingiva. Below is the vestibular mucosa. So the junction between the attached gingiva and the vestibular mucosa, what is it? It is the mucogingival junction. That is very clear. And this is a simple question and an easy question. And last two options, which were obviously not the answer, those have not been recalled. Still, if you can help us in letting know those options, it would be very nice. But here, option number A, which is mucogingival junction, remains stationary throughout the life. And option number B, which is mucogingival junction, it is mucogingival junction and changes after every 14 years. We know B is not correct, right? It is A, mucogingival. It is mucogingival junction and it remains constant throughout the life. So the answer to this question is option number A. Okay. Now, the next question here is, which of these is the most common cause for fibrous gingival hyperplasia? Which of these is the most common cause of fibrous gingival hyperplasia? The options were nifedipine, Option number B was acetoaminophene. Option number C is amoxicillin. Option number D, we are not sure whether it was tranexamic acid or something else. Let us know what was it. But if these were the options, then option number A, which is nifedipine, is the correct answer, because fibrous gingival hyperplasia occurs in drug-induced gingival enlargement. Okay, so the answer to this question is nifedipine. Now the next question, how are age and periodontitis related to each other? How are age and periodontitis related to each other? Option number A is age is the etiological factor for periodontitis. Option number B, age is not related to periodontitis. Option number D is age is a background characteristic risk factor for periodontitis. And option number D is age is a risk marker. Now, for this, we have already studied this chart, right? The risk assessment categories, which are risk factors, risk determinants. Risk factors are classified like this. We have studied in our like recorded and live sessions both. We have discussed this. So in this, we can clearly see that age is mentioned here. It is a background characteristic or risk determinant. So the answer to this question is option number C. Okay. Now the next question. Beta defensins 1 and 2 are absent in. So guys, this is from normal periodontium, the anatomy of gingiva. And this is like not frequently studied, not very frequently studied thing. So some of you might have this is a little bit difficult question, I would say. The options here are saliva, junctional epithelium, circular epithelium, and connective tissue. So remember that beta defensins are the molecules which help in defending against the bacterial antigens which are present. Okay, so beta defensins 1 and 2, they are present in saliva, they are present in circular epithelium, and they are present in some quantity in connective tissue, but they are absent from junctional epithelium. Okay, they are absent from junctional epithelium. So the answer to this question is option number B, which is junctional epithelium. Remember that beta defensins are present in a large amount in saliva and gingival epithelium. In gingival epithelium, they are present. In circular epithelium, they are present. In smaller amounts, they are present in connective tissue, but they are absent in junctional epithelium. So the answer to this question is junctional epithelium. Okay, now the next question. Merkel cells are most commonly seen in. This is also from the chapter gingiva. We are focusing a lot on gingiva in our sessions, right? Gingiva, anatomy of gingiva. It is very important topic. You must read it very nicely. So, Merkel cells are non-keratinocytes, right? And these Merkel cells, these are responsible for sensations, the touch, pressure, pain sensations, right? So, they are present in option number A, stratum spinosum. Option number B, stratum basale. Option number C, stratum corneum. And option number D is stratum granulosum. So they are present in stratum basale. So the answer to this question is option number B, which is stratum basal. Okay. Now, the next question. Patient having, this is an application, not application based question, but yes, this is from the topic systemic disease and periodontitis and gingivitis, and we have studied, I have recorded this session. I have recorded the relation of diabetes mellitus to gingivitis. So in this question, they are asking a patient having gingivitis with type 2 diabetes mellitus, what is the most common subgingival flora? The options were actinobacteria and fusobacterium nucleatum. In this also, guys, see, these are bacteria, right? There can be multiple options, and it is really confusing to recall bacteria. So if you feel that these bacteria were not there and something else was there, do let us know in this comment section. Okay. Option number A is actinobacteria, and fusobacterium nucleatum. Option number B is Prevotella intermedia, Annulla forsythia. Option number C is P. gingivalis and Treponema denticula. Option number D is Tannerella forsythia and Streptococcus. So, see, directly, many of you, for many of you, this question would have been difficult. It was not an easy question because majorly this is a new question, right? Type 2 diabetes mellitus and relationship between the microflora. So don't get upset if you got this wrong, but directly it is not given anywhere. It is, I think, from some articles. Many articles are mentioning it, the microflora which increases in diabetes mellitus, and the answer to this question is option number A, which is actinobacteria and fusobacterium nucleatum. Okay. Now the next question. A patient reported with mobility. Yes, Rohit, you are saying you have one doubt. You can post your doubt. I'll answer it. Question number 9 is, a patient reported with mobility with respect to mandibular posterior, mirror-like image with bone loss was seen. What will be the diagnosis? So here you can see these are the typical. This is an easy question, and these are the typical features they are depicting of aggressive periodontitis. Right? There is image like bone loss. Mandibular posterior means first molars are involved, and there is mobility. The bone loss is mirror-shaped bone loss. Mirror-shaped bone loss word is coming by itself. You must know that it is localized aggressive periodontitis. Okay, it is localized aggressive periodontitis. Okay. Now, the next question. Ordland bodies are option number A, modified lysosomes. Number B, mainly present in stratum basale. Option number C, secrete alkaline phosphatase. And option number D is not recalled. You can let us know what is the option number D here. If these were the options, so guys, for this, the answer here is Ordland bodies they are modified lysosomes. They are mainly present in stratum spinosum, right? And they secrete acid phosphatase. So the correct answer here is modified lysosomes. Okay. Now the next question. Identify the true statement about chronic periodontitis. This question is also a little bit doubtful, that what were the exact options here. Options here were very lengthy. So if any of you recall the correct options here, do let us know. Okay. So option number A is gingival inflammation is present in chronic periodontitis. Option number B is attachment loss in chronic periodontitis is reversible. Option number C, attachment loss is chronic periodontitis is irreversible. And option number D is both A and B. So here the answer will be that gingival inflammation definitely is present in chronic periodontitis, and there is attachment loss which is reversible. If properly oral hygiene is maintained and proper treatment is given, it is reversible. I'm not talking about means with periodontal regeneration, it is possible. So the answer here is option number D, which is both A and B. Okay. Now the next question. A 12-year-old girl reported with erythematous generalized marginal gingiva. Here the girl is 12-year-old, erythematous marginal gingiva. There was no bleeding on probing. There was cleft formation seen on the gingiva. The blood investigation revealed abnormal neutrophil count. If these wordings were there, if these keywords were there, what will be the diagnosis? Option number A is pre-puberty periodontitis. Option number B is neutropenia. Option number C is chronic periodontitis. Option number D, not recalled properly. So the answer to this question is option number A, which is pre-puberty periodontitis. Okay, it cannot be chronic periodontitis for a 12-year-old girl. It should be A, which is pre-puberty periodontitis. Now the next question. Brushite is seen in which area most commonly? This also from the chapter dental calculus, a repeat question from a repeat topic. We all know that brushite is common in supragingival area of mandibular anterior region, supragingival calculus of mandibular anterior region. So the answer to this question is option number B. Okay, in pre-puberty periodontitis was not there. I am getting this. So yes, please let us know what was the correct. So if this is doubtful, guys, let us know what was the correct question. The question was the same. Whether the question was the same or the question was also different, do let us know. Okay. Now, the next question is most common organism in subgingival plaque in a patient with chronic periodontitis. Most common organism in subgingival plaque in a patient with chronic periodontitis. Option number A, P. gingivalis. Option number D, Tannarella furcitus. Option number C, Aggregatibacter actinomycetum comitans. And option number D, Prevotella intermedia. Most common organism in subgingival plaque of a patient with chronic periodontitis is, most commonly, it is P. gingivalis. If this was the question, because there were many questions from dental plaque chapter, specifically bacterial complexes. So there are some confusions in the options, guys. Please let us know. We can correct it always. Okay. Now, okay, I feel that in that question, neutrophil with there is some acute lymphoblastic leukemia also there in the options. We can always correct it, guys. Okay. Now the next question is maintenance period of recall. So this question is not recall, but I think the question was something like the maintenance in the maintenance period, the duration, the time duration of recall, right? During the recall, in the maintenance phase, what is the time duration of visit? Something like that was the question according to the options, because the options I got were this only. So it would have been the duration, right? It would have been the duration of visit during a recall interval, right? Whether it is 2 hours, whether it is 1 hour, whether it is 1 hour 30 minutes, or whether it is 30 minutes. So the answer to this question is, if it was just the duration of visit during maintenance phase, the answer to this question is option number B, which is 1 hour. Okay, the answer to this question is option number B, which is 1 hour. Okay, guys. So I think 2 to 3 questions are not properly recalled. We will do the recall, like I'll make the changes according to your suggestions. And thank you so much. All the best for your results, guys.
Students, so here we are for our mega recall session for dental anatomy and dental histology. So I think most of you have attempted the questions. Questions were very easy, direct questions, right? So let's start with our discussion. Coming to our first question. Von Ebner glands are primarily, are they mucous glands, are they serous glands, or are they mixed glands? So what will be the correct answer here? They are mostly purely serous glands. Correct answer is serous gland, right? What are von Ebner gland? Where are they present? They are mostly serous glands present between the muscle fibers of the tongue below the circumvallate papillae, right? They are posterior lingual glands. Their ducts open in the trough of the valate papillae. They also secrete which enzyme? Lipase, lingual lipase, which helps in digestion of lipids. Also, it secretes lysozyme and peroxidase. So mainly they are purely serous glands. This we have in our notes as well, right? So these are our notes in which I marked the line that was present. Von Ebner glands are mainly serous, right? So we have mentioned in our notes also, we have discussed this in our live class as well as our recorded class. This question is very easy and straightforward. Now coming to our next question. Merkel cells are seen in which layer of epithelium? So what will be the correct answer here? Stratum basal, stratum granulosum, stratum corneum, or stratum spinosum? Correct answer is basal. They are pressure receptor cells, right? So they're mostly close to the nerve fibers. And as they're close to the nerve fibers, they're mainly present in the basal layer. This also we have discussed it in our PCT, post-class test. Same question, right? So Merkel cells are mainly present in the basal layer and they are pressure receptor cells. In notes also, we have discussed about the Merkel cells along with the diagram. Here you can see in the basal layer, the cells are present close to the nerve fibers. So definitely stratum basal is the correct answer here. Coming to our next question. Identify the structure marked with a red circle in the given image, right? So I think this type of image-based question was there, right? So this diagram is of which stage? Developmental stage, morphological developmental stages of tooth development. It is cap stage, right? So this structure in this cap stage is mainly a transient structure. It is what? It is a transient structure. So it is one of the transient structure seen in cap stage. Now, it appears like a cluster of cells near the inner enamel epithelium, right? Here we have our inner enamel epithelial cells. So near the inner enamel epithelium, the cluster of the cells is what? Basically, it is enamel knot. So the correct answer here is enamel knot. Enamel cord is vertical extension of enamel knot, right? So it is not the correct answer. Enamel organ, whole, this is enamel organ. So definitely it is also not the correct answer. Enamel niche is mainly an defect during artifact tissue sectioning, right? So here we can see in this diagram also, we have discussed this in our live lectures as well as recorded lectures. You have this in your notes as well. So 5 number you can see here. Here, this is our enamel knot. Then its extension is our enamel cord. Enamel cord meets the outer enamel epithelium at enamel septum. And there we have a depression which is enamel navel. So these are basically the transient structures of cap stage. Enamel knot, enamel cord, enamel septum and enamel navel. So these are the transient structures. And what is the role of enamel knot? It helps in determining the shape of the tooth. It mainly helps in determining the shape of the tooth. It also acts as a reservoir of dividing cells. So don't get confused here. It is mainly enamel knot, densely packed cells near the inner enamel epithelium. Next, coming to our DA question. Mesiolingual developmental groove is present in. This also we have discussed in many test series as well as this we have discussed in our test and discussion also, right? TND. And I have shown 3 different types of groove also: palato-radicular groove, mesiolingual developmental groove, mesial marginal developmental groove. We have discussed these 3 grooves also every time when we have a question on any one groove. So mesiolingual developmental groove is seen in, it is mainly seen in mandibular first premolar. Mandibular first premolar. You can recall this diagram also. We have discussed this. Here you can see mesiolingual developmental groove present on the lingual aspect of mandibular first premolar. So this is our mesiolingual developmental groove extending on the lingual aspect. So these are our notes. This we have discussed in our notes also. And we have given separately it as a MCQ question. Mesiolingual developmental groove is a characteristic feature of mandibular first premolar. Right. Now coming to our next question. Which of the following is true regarding the following image taken in a polarized light? Is it cementum overlapping with enamel in decalcified section? Is it cementum overlapping with enamel in ground section? Polarized light. CJ bud joint in decalcified section. What is bud joint? Edge to edge. And CJ bud joint in ground section polarized light. So what will be the correct answer here? First, we need to see the image. So in this image, can you see? Here, where enamel is ending, their cementum is starting. So definitely it is a edge-to-edge junction, sharp junction, bud joint, right? It is not overlapping junction. So it is a sharp junction. So definitely answer will be from C and D. So now coming to the diagram. It appears as a ground section in polarized light because in decalcified section, usually you can see mostly H&E stain section. And in decalcified section, there is mainly loss of inorganic component. So enamel has 96% inorganic component. So definitely enamel will be very less visible in our decalcified section as most of its inorganic component is lost. As enamel is having 96% inorganic component, it is difficult to visualize it in decalcified section. So definitely it is in ground section under polarized light. So here we have three different types of junction. This is our overlap junction. This is our gap junction. And this is our edge-to-edge junction. So the correct answer here is what? CJ bud joint in polarized light. Right. Now coming to our next question. This also we have discussed in our TND. Which stage of amylogenesis is shown by figure 5 and 6, right? So what will be correct here? 5 and 6. So here we can see what? Here we can see ruffled border as well as we can see smooth border, right? So which will be this stage? It is definitely a maturative stage. It is definitely a maturative stage. Why? Because in maturative stage, length of the amyloblast becomes short. They undergo transitional stage and modulation stage. So in modulation, the amyloblast cell will develop ruffled border as well as smooth border. Ruffled border for incorporation of inorganic components and smooth border for removal of organic components, right? So once organic matrix is laid down, then it will be removed and inorganic component will be incorporated. So here 5 and 6 is definitely our maturative stage. So is it morphogenic? Morphogenic is mainly initial stage, right? Organizing stage, where dentine formation starts. Protective stage, that is in which the tooth will be covered by reduced enamel epithelium, and maturative stage. So the correct answer here is maturative stage, where there is incorporation of inorganic components along with removal of organic components. So for incorporation and removal, the amyloblast cells develop ruffled border and smooth border. And this is mainly during the maturative stage. So basically we have 6 stages in life cycle of amyloblast. MOF, MPD. Morphogenic, organizing, formative, maturative, protective, and desmolytic. Right? So in morphogenic, shape of the DJ is determined mainly. Then coming to our organizing stage, dentine formation, formative stage, reciprocal induction, and first layer of enamel will be deposited. Maturative stage, maturation, deposition of inorganic components. Protective stage, as calcification is there, then the calcified layer is protected with a protective layer covering, that is our reduced enamel epithelium. And during desmolytic stage, this reduced enamel epithelium will secrete enzymes, and as a result of which the reduced enamel epithelium and the oral epithelium will fuse together and the tooth will erupt into the oral cavity. Right? So don't get confused here. Here in this diagram, we have discussed this in our notes also, in many our test series, TND, right? So ruffled border and smooth border. So it is definitely maturative stage. These are our notes. In notes also, we have the same diagram, right? Here you can see 5th and 6th stage. And we have discussed this ruffled border and smooth border, which is definitely maturative stage. Coming to our last question. Accessory cusp present in mandibular molaris. Is it protostylid? Is it cusp of carabelli? Is it dense evaginatus? So it is mainly protostylid, present on the buccal aspect of the molar. Cusp of carabelli is mainly present in maxillary molars. And dense in evaginatus is also extra tubercle present between the cusp. It is also known as Lyong's premolar, right? So the correct answer here is protostylid. So I think very easy question and straightforward questions. You might not be having any doubt in this now. Most of the questions we have discussed during our lectures as well as our test series. So good to go. All the best. Take care.
A very lovely good evening, all of you. Well, is my voice audible? Hello, good evening, everyone. Is my voice audible and the screen visible? Okay, so let's start with the discussion of the biochemistry questions. Now, if I see the questions this time, little bit was asked from genetics, isn't it? But if we see most of the questions we have been discussing in the class so many times. I hope, first of all, before discussing the questions, I just want to ask you people, how did your exam go? Was it tough? Was it moderate? Because yesterday also I was just seeing the messages in the group. Most of the students were saying it was moderate. Okay, and there was so much question. I mean, like some ifs and buts were regarding the biochemistry questions also, because somehow we managed to gather some 5 questions. So some of the options are given, some of the options are not given in that. So you guys are going to help me in it. Okay. So first of all, I would again like to invite you all on behalf of DBMCI. So let's see question number 1. Now, this question number, I think this comes by default, and most of you must have got it right. Kesal necklace occurs due to the deficiency of. And if you people remember, so many times we have discussed this question in the class regarding Kesal necklace, regarding the vitamin, regarding the amino acids. And I have always told you this thing in the class, this question is sure and short going to come, isn't it? So if we talk about Kesal neck occurs due to the deficiency of, and the same picture we've been discussing in the class so many times. We know that Kesal necklace occurs due to the deficiency of niacin, isn't it? And this niacin is vitamin B3, right? Which is a very important endogenously synthesized vitamin. And I told you in the class that whenever we talk about these vitamins, there are 2 endogenously synthesized vitamins. One is your B3, which is synthesized from tryptophan. And we know that 60 milligram of tryptophan is required to produce 1 milligram of niacin. Right? So we can say this is first endogenously synthesized vitamin, and the second is vitamin D, which is obviously synthesized from cholesterol. Okay, so coming over to this, we know that this is what? This is actually the hyperpigmentation, which is photosensitive. And this is a characteristic feature of B3 deficiency, that photosensitive dermatitis is there. And so many students have been asking questions to me on vitamins. So this is one of the most unique feature, which fits into vitamin B3 or niacin. And we know in photosensitive dermatitis, or you can say there is pellagra due to vitamin B3 deficiency. And this pellagra is characterized by 3Ds. If you remember, 3Ds means 1D stands for diarrhea, second stands for dementia, and third stands for dermatitis. And if it is left untreated, it will lead to the final D, the fourth D, which is death. Right? So I hope this question majority of the students must have got right. I am pretty confident about this because this we have discussed so many times in the class. Right? Clear? Okay. Then moving on to question number 2. Now this question number, whatever I got, the gist which I got from the question is that demyelinating disease of spinal cord is caused by the deficiency of. So if we just have a look at this question, obviously the 3 options which are given to us are from vitamins. So I can say fourth vitamin, if we talk about, let's take B6. Because we can say B6 and B12, their functions are more or less similar, isn't it? So now here, if we talk about demyelinating, because one of the students told me demyelinating vitamin is. So always remember, beta, vitamin B12 is responsible for the synthesis of methyl malonyl coenzyme A, which is actually required for the myelin sheath. And if you remember, and if we go back to the reaction, this was the reaction. Okay, this basically propanol coenzyme A. This reaction also I've discussed so many times in the class again. So whatever questions came in your exam, majority of them were asked in the class, isn't it? So this propanol coenzyme A undergoes carboxylation. And if you remember, I told you carboxylation ke liye you have to remember that mnemonic ABC. A stands for ATP, B stands for biotin, and C stands for carbonate ions because it is carboxylation. So this propanol coenzyme A forms methyl malonyl CoA. Right. And this dimethyl malonyl CoA is converted into L-methyl malonyl CoA. And this L-methyl malonyl CoA forms succinyl coenzyme A. And what happens here is B12 is the coenzyme of the vitamin of the enzyme mutase. So coenzyme is B12, enzyme is mutase, and obviously coenzyme is the vitamin. So if I say deficiency of B12 is there, right? There is accumulation of methylmalonic acid, leads to methylmalonic aciduria, and there is demyelination, and continuous deficiency of B12 will lead to subacute axonal degeneration. Very, very important. Subacute axonal degeneration is carried out in the absence of B12. Okay, so here, whatever may be the options, here the answer will be B12. Okay, irrespective of other options, because always remember demyelinating enzyme, yeah, demyelinating vitamin, I would say it is B12 which is functioning as the coenzyme. Right, so I hope you guys agree with this. Okay, then moving on to question number 3. Now here there was a confusion. If I talk about this question, beta, MELAS. Okay, so MELAS actually stands for, as you can see, mitochondrial encephalopathy is there, lactic acidosis is there, and leading to stroke-like episodes. So is associated with this. So if we talk about particularly this question, okay, just keep on reminding, actually this MELAS is nothing but a disease related to the mitochondria, because we know that mitochondrial DNA is similar to that of prokaryotic DNA. Yes or no? Okay, so I can say that this mitochondrial DNA is similar to that of prokaryotic DNA. And the most important feature about this mitochondrial DNA is that it is having no introns. So there are more chances of mutation in this. So they are at a higher risk of mutations. Now coming over to this, whenever they are undergoing translation, what happens is, because mitochondria is considered to be the seat of respiration. Okay, or because they are the site of synthesis of ATP, which is leading to electron transport chain. Right. So according to me, the answer should be it is associated with the electron transport chain. Why? Because most of you must be confused, and up to my knowledge, basically what happens is it affects the complex 1 and complex 4 of electron transport chain only. Okay, so no doubt they are mitochondrial diseases, right? But they are associated with electron transport chain. So as per me, the correct answer should be electron transport chain if these are the options which were asked in the exam. Because mitochondria is a very vague term, no doubt. Mitochondria will, I would say, complete all. Similarly, cytochrome complex, but there are so many other cytochrome complexes also. Cytochrome, you can say complex 1, if we talk about complex 2, they are handing over the electrons to complex 3, which is again cytochrome BC1. And the fourth is your cytochrome A1, A3. So there are so many cytochrome complex. But here we have to just consider complex 4 and complex 1. So again, we can say cytochrome complex is a very vague term. It is not properly concentrating on that particular thing. Getting my point? So above all, the correct answer should be electron transport chain. Okay, and this is a very important mitochondrial disorder. And always remember this also I told you in the class, but yes, we didn't take in so much detail. But yes, one thing I mentioned in the class was that mitochondrial DNA we have studied in detail. So this was a slight unexpected question, I would say, but yes, it is an important question. Okay. Then moving on to question number 4. Now, if we look at question number 4, this question we have discussed in the class so many times again. A very simple question, and I told you all the permutations and combinations how to solve this question, and I gave you one mnemonic also in the class how to remember this question if you remember the mnemonic. The question is, a child gets easily fatigued and cramps in the calf muscles on running due to the deficiency of which of the following enzyme related to glycogen metabolism. And I told you one, just forget about all the enzymes. I told you one very important concept about this. Whenever we talk about anything related to the muscle, there is muscle fatigue. Why muscle fatigue is there? Because of, yeah, somebody wants to say? Okay, right. So you can say that whenever we talk about muscle fatigue in the muscle, it is associated with the energy provided to the muscle. And what provides energy to the muscle? Breakdown of glycogen, isn't it? So you can say glycogenolysis ke liye, which is the rate limiting enzyme, it has to be glycogen phosphorylase. But here we are talking about the muscle. So the deficient enzyme needs to be muscle phosphorylase. Okay, and that is the characteristic feature of which disease? McArdle's disease. And glycogen storage disorders I have discussed with you so many times in the class. And I told you one key point about all the glycogen storage disorders. And this though I have so many times I've told you कि muscle glycogenolysis pe one way or the other the question is generally asked. So we can simply say glycogen synthesis, no. Glucose 6-phosphate stays, no. So it has to be myophosphorylase, or simply it is muscle phosphorylase. So forget about the fourth option. Okay, so it is but obvious. So I can say that the child is suffering from McArdle's disease. Or we can say the deficient enzyme in McArdle's disease is muscle phosphorylase. And here also, if you remember, I told you that muscle phosphorylase is McArdle's disease, then Tarui's disease is one more disease related to this disorder. But in Tarui's disease, what happens is the deficient enzyme is phosphofructokinase. Okay, and here second wind phenomenon is present, whereas second wind phenomenon is absent in Taro's disease. And if we talk about the clinical features here, we can simply say that if a person is deficient of this, there is burgundy color of urine. The urine becomes burgundy in color. Very important. Okay, and second wind phenomenon is present. Right? Is present. So you have to keep this thing in mind. And this we have already told. So whatever is the fourth option, the correct option is muscle phosphorylase, or you can say myophosphorylase. Is it clear? Right. And one more thing, if we talk about glycogen synthase, if glycogen synthase is deficient, it leads to type O or type 0. It is difficult for the child to survive also because glycogen is not synthesized only. So there is no question of storage. And glucose 6 phosphatase, von Gierke's disease. So I would say the main difference between this is von Gierke's disease is the most common diseases in infants, and McArdle's disease is the most common disease in the adults. Right? So here the answer has to be myophosphorylase or muscle phosphorylase. So fourth option kuch bhi hoga, you can just write it, but you have to, because the answer is already there. So I hope this explanation is also clear to all of you, and obviously so many times I have discussed this particular question in the class. Okay, then moving on to the next question. Now there were two questions from genetics, and yes, this crew chat is due to the genetic mutation, because this you guys study in pathology also. Okay, so here if we say this crew chat is due to the genetic mutation of 5p. Okay, so again, if you guys get confused between 5p and 5q, the basic difference is 5p is crew chat and 5q mein kya hota hai? It is more common in adults or older people, not children. And 5qp is basically in the children, and as it is clear from the word itself, crew chat, the child cries like a meow, or you can say like a cat. Okay, so this question was, yes, a little bit, I would say, hatke from biochemistry, but yes, definitely this is a part, because genetics generally is covered in pathology also. Right, but this time it was asked in biochemistry, even I was surprised. Okay, then again another question, this is also generally explained in pathology. Right, this is simply there is a pattern of inheritance, I would say. Autosomal dominant is there, we know okay, autosomes are there, sex chromosomes are there, recessive is there, dominant gene is there. Here the question is simply, if a mother is carrier for autosomal recessive conditions, ek to autosome, and the father is normal healthy male, so what shall be the inheritance pattern seen in children? So this is little deviated, I would say, from biochemistry. Okay, but since you people have studied it in pathology also, and in your 11th 12th classes, if you guys remember, right? So if we talk about this, so what you have answered in this? Any ideas? Ah, yes, okay. I'm just looking at the options. 1 second. Okay. Yes, very good. Correct. All children affected. How come? 50%. Yes, Florence. Actually, these type of questions are generally asked in INI-CET exam. Yes. Dekho. Now, how to solve this question? Yes, very good. So yes, very good. No, not all children are affected. Beta, one thing. Yes. Yeah. देखो बेटा, one thing. 1 second, let me just see the answers. Okay. So coming over to this. Acha, in Mela's question, cytochrome 1 and 4 was mentioned. Can you, beta, tell me the other possibilities of Mela question? Wait, let me just take you to that question first. 1 second. Yes. Okay, so if you correctly remember what were the options, then we can, go for some good explanation. Yes, A. 1 second, Manoj. I just want to hold it on because Mela's, I'm just looking at the explanation. In Mela's, cytochrome 1 and 4 was mentioned. See, if cytochrome 1 and 4 was mentioned, okay, so we can say that the most appropriate one has to be electron transport chain. Why? The reason being complex 1 and 4 kya hai? Complex 1 and 4 is basically the components of electron transport chain. Getting my point, A? Okay, Saurabh. Saurabh, can you just tell me the other options also, if you remember? Saurabh and A, if you remember the rest of the options. Beta, this also. है ना? So here, देखो, because whatever questions are being framed, that is because the students tell us certain options and we just frame questions as per that. But still, if any confusion is there in your mind, since it is the live session, you people can ask us. So whatever queries are there in your mind, we are there to help. Okay, beta. If it was ETC with 1 and 4, so then obviously this is the correct option. I told you, I told you the entire scenario. What is the entire scenario? Melas are the mitochondrial diseases. Okay. What happens is because there is a difference in the proteins. What happens because since it is occurring in the mitochondria, the electron transport chain is the one which is affected. And again, one more thing I'll tell you. We know that this mitochondria are the powerhouses of respiration. So basically in body, what happens is since ATP is not synthesized, okay, so if ATP is not synthesized, the body will undergo anaerobic metabolism. And since the body undergoes anaerobic metabolism, it leads to lactic acidosis. And this lactic acidosis lead to stroke-like episodes. Getting my point? Yes. So if it was cytochrome 1 and 4 of electron transport chain, the answer will be this. If it was mitochondria, no electron transport chain, the answer will be mitochondria. But if it is written mitochondria as well as electron transport chain, it has to be electron transport chain. So I hope you understood it now. Okay. This question is clear to all of you. This question is clear, beta. So I think I should move ahead. We'll move forward to another question. Okay, chalo. We will move to this question. So many 25%, 50%, so many other options are coming. It's as simple as that. Just keep one thing in mind, autosomal recessive. We know that autosomes are there. Okay, so we can simply say that AA will be the genotype of the father. Okay. Yes, I'm coming to that, beta. And AA will be the genotype of the mother. That is what is written. A mother is a carrier for autosomal recessive. And the father is a normal, healthy male. So what shall be the inheritance pattern? You just by Punnett square. We know that Punnett square is required for this. Okay, so it's like AA, AA. Okay, yes. So we can simply say that formative stage was given in which, beta? So it will be AA, AA, So you can simply say that 50% is going to be healthy and 50% will be the carriers. Right, so answer here will be 50% will be healthy and 50% will be the carrier. This is how you have to solve it. Understood? Is it clear to you, all of one option was all carriers? No, beta. Or how can all be carriers? You can see that because recessive is there. Dekho, there is a difference between recessive and dominant. This is we are talking about, and that too, the mother is a carrier. Getting my point? Mother is not completely, following both the genes. Mother is a carrier. So the genotype will be this. Okay, one question only correct in biochem. Oh, no problem. This time, actually, I would say ki if you have actually attended my classes, so I can say 4 questions should be correct from our side. 4 questions out of 6 questions. These questions also because this is a part of pathology generally, but yes, next time in my current session, definitely I'm going to incorporate little bit of genetics in this also. Okay, so anything else in biochemistry? Because that's what Saurabh, that's what I was surprised. Very easy questions this time they were from biochemistry. If I talk about this question, I remember so many times it's been, I would say, donkey's years I've been talking about this question again and again. It is not possible, Nikesh Maheshwari. No. How is it possible? Because the father is healthy. Okay. So this question, though, I have discussed so many times in the class, muscle phosphorylase, glycogenolysis. So many times I told you, you have to pay focus on the muscle related point with alcoholic history deficient in vitamins. Beta, if we talk about alcohol, I told you one more thing. Let me just add a page here. If it was asked, I will just tell you what all you have to do in this. See, if we talk about alcoholics, ठीक है. Only one question is correct. Correct. No problem, beta. Alcoholic diseases. Yes, I'll just come to that. Yeah. See, first of all, you should know ki what is the metabolism of alcohol. This also I have explained in the class. So we simply say ki alcohol kya hota hai. Say what you drink. Either you drink methyl alcohol, you never drink. You always drink ethyl alcohol. I mean, like alcoholics. So it is converted into aldehyde and it is converted into an acid. Okay. So what happens is NAD, NADH plus H positive, NADH plus H positive. So always remember one thing, this alcoholism always decreases the absorption of B1. Right. And B1 is thymine pyrophosphate, which is required for oxidative decarboxylation. We all know that. Okay. Vernix, beta, I'm just coming to that. Yeah. So the active form is TPP. We know that. TPP is required for oxidative decarboxylation. This also we know. So you have to just target one reaction, which is simply conversion of pyruvic acid to acetyl coenzyme A. And this also I have repeated in class so many times. This time I am surprised that this question did not come in the exam, but this generally is asked in the exam. You know that. So pyruvic acid in the presence of PTH, this is an irreversible reaction. And pyruvic acid is converted into lactic acid by a reversible reaction. The enzyme is LDH. Up PTH में, this B1 is the one which is taking carbon dioxide. Okay. So what happens if this PDH or if this B1 is deficient? This PDH cannot work. If PDH cannot work, there will be increased concentration of pyruvic acid. No question from carbohydrate. No carbohydrates. Beta, one question was asked, muscle phosphorylase, but yes, it was a simple question, I would say. Okay, so increased concentration of pyruvic acid, increased concentration of lactic acid, so lactic acidosis is there. Now the question is, एक तो the person is B1 deficient, ऊपर से the person is alcoholic. ठीक है, तो it's like सोने पे सुहागा. So what will happen is, if he is B1 deficient and into alcoholism, so what happens is it leads to Wernicke's or Wernicke's encephalopathy. And I have told you we have to remember the mnemonic as Goa. Okay, LDH का भी question. Okay, so Goa में G stands for global confusion, O stands for ophthalmoplegia, and A stands for ataxia. And if this is untreated, it will finally lead to Korsakoff psychosis. And if we talk about Korsakoff psychosis, the most important one are amnesia, whether it is retrograde, whether it is anterograde, amnesia is there. Okay, and confabulations. So we can say that the enzyme required, you can say the vitamin which is responsible for Wernicke's encephalopathy in alcohol is vitamin B1 or thiamine. Or okay, one question was from liver history. Okay, 1 second. One question was from liver history, increased AST and LDH. Beta, increased liver history mein AST is the one. Right. And if we talk about, this question was also asked. In what form this question was asked? Can you just tell me, beta? Okay. Right. So it will be AST in liver diseases. Okay. Right. B vitamin responsible for heart function. Beta, there are so many different functions of vitamin B, isn't it? LDH isoenzyme in liver problems is LDH5. LDH1 in MI, LDH5 in liver diseases. This also we have discussed in the class. Okay. Yes. LDH increases in 5 fraction will increase. 5 beta 5. Okay. So I think biochemistry explanation is clear. Increased beta, not decreased. In liver problems, LDH5 will be increased, and in MI, LDH1 increases. Okay. So this is all about biochemistry. So I hope the explanations are clear to all of you. So shall we wind up today's session? हाँ बेटा, wet beriberi में edema will be there. And this is the main difference between wet beriberi and dry beriberi. Wet का मतलब ही क्या हुआ? There is retention of the fluid inside the tissues, so it leads to edema. Okay, chalo, so wishing you guys all the best. I hope this time you people just, clear the exam. So my blessings are always with you guys. Okay, so take care. Yeah. Bye bye, all of you. Yeah. Okay.
Okay, so hello, my dear students. How are you all? How was the pedo part? How did your pedo subject go? There were a lot of questions from pedo, and mostly all of them were clinical, right? So how did it go? Okay, so can you all please just start answering so that I'll know that you guys can hear me, you guys can see. Hi, Rohit. Okay. Yeah. So are you all guys with me? Are we here for pedo now? Should I begin with the pedo questions? Hi, Amrind. Yeah, you all can hear me. So let me begin with pedo. All right, I hope you guys are there with me. And so there were a lot of questions that were clinical, mostly clinical questions, direct picks from the questions that we had read, direct picks from the notes. And I think everybody who was, following, everybody who has attended the live classes and the, revision classes, the GT discussions, I am sure you would have got all the questions right. So let me begin with the first question. I just want to be extremely sure that you all are with me. Okay, so the first question that I retrieved was a very simple question. My God, I hope nobody got it wrong. So identify the theory of child psychology that includes the concept given in the image. So an exactly similar image was there in our notes. We had discussed a lot about the iceberg phenomena. Yeah, so the iceberg phenomena, where you have the conscious mind, the pre-conscious, and the unconscious mind. And yeah, okay. I think there are. Yes. So the answer straight away, without giving it a second thought, it is the psychosexual theory that was given by Sigmund Freud. So I hope you all remember Sigmund Freud gave the iceberg phenomena, he gave the topographic model, and you have both of them in this particular picture. There is the iceberg phenomena that gives you the conscious, pre-conscious, and unconscious mind, and then there is the topographic model that tells you about the ID, ego, and the superego, right? So both of them are here. Both of them were given by Sigmund Freud, psychosexual theory. There is no second thoughts for this. It is a factual question. Okay, so Erik Erikson, different theory, Jean Piaget, Ivan Pavlov, the dog wala concept. I hope you all remember. So without any discussion, Sigmund Freud's psychosexual theory. No questions asked there, right? Okay, so now we have the second question that was, a patient with age 5 years has primary second molars missing bilaterally. Which space maintainer would be indicated? Okay, so that was the question. So you have a 5-year-old patient, and both the second molars, both the primary second molars, both the E's are missing bilaterally. So which space maintainer can you use? Can you use a lingual arch? Okay, so are we saying B for the first one? Okay, so now everybody saying B for the first one. Sigmund Freud, we're done with it. Okay, now let the answers come for this one, whether it is a lingual arch or a bilateral band and loop or reverse band and loop or removable acrylic space maintainer. Okay, so a lingual arch will be given when you have a scope of placing a band on the molars, and then there is an extension wire of it that comes and runs through the anteriors. Okay, so there are, since the child is 5 years old, there are no permanent molars. Okay, that is why I remember the last thing that I told you right before your NEET exam in the group where we discussed the doubts is, wherever they ask you a question related to space maintainers, be very careful of the age of the child that they've given you. Read the age. So now 5-year-old child, that means there are no permanent molars that are present. Okay, just give me 1 minute. So yes, right? So let me open your chats first. Are you saying there were different options there? How do you think it can be lingual arch? It cannot be lingual arch, no. See, because where will you adapt the bands of the lingual arch? The bands of the lingual arch will be adapted where? On the permanent molars. Now, since the child is 5 years of age, do you think the permanent molars would have come? The permanent molars stay unerupted at the age of 5 years. So there are no permanent molars. There are no primary second molars. So the arch is beginning from the primary first molar only, primary first molar and ahead. So where are you going to adapt the band of a lingual arch? Um, Yeah. Okay. Okay, the question was not about bilaterally missing, but somebody told me there were two types of questions. There was a question where a single side it was missing. I've covered that question also. And somebody told me there was bilaterally missing. So I've taken both the questions. Okay, it was bilaterally missing. You guys first decide. Half of you are saying that it was bilaterally missing. Right. But, jokes apart, here you cannot give a lingual arch, you cannot give a bilateral band and loop because you need a distal molar to adapt your band on. There is no permanent molar. There is no, what do you call as, yeah. So huh. So what you have to do is you have to give a removable acrylic space maintainer only. What is a reverse band and loop? See, I will tell you. Whenever you do not have a second, understand very, carefully. Whenever you don't have a second primary molar, the second primary molar that is denoted with E. So there is no E, there is a D, and the permanent molar is partially erupting. Okay, the permanent molar is partially erupting. So what you do, you adapt the band on the D and your loop runs towards the partially erupted molar, partially erupted permanent molar. Since it is partially erupted, you cannot give a normal band and loop because partially erupted molar will not have space for the band to adapt, right? So the band will be adapted on D and your loop will run backwards, that is towards the partially erupted permanent molar. That is called as reverse band and loop. Now here there is no partially erupted this thing also, permanent molar also, because the patient is only 5 years of age. 5 years may the permanent molar will not erupt. So the only option here is you have to give a removable acrylic space maintainer. Okay. Yes. Okay. Yes, I've covered a question regarding the loss of primary first molar also. Okay. Yes, about that also. Right. Anyways, you got to learn a new concept. Now I've covered that first molar. Somebody told me there's a bilateral missing also. Okay. Anyway, so the question number 3 is a 3-year-old child has a DMFT score of 4. So the child is 3 years old and the DMFT score is 4. What type of caries will you classify the condition as? Okay, so during ECC, we had read that the ECC can be classified into mild, moderate, and severe. You all know what is nursing bottle, you all know what is rampant caries. Okay, so why have they given a DMFT score? How does the DMFT score relate to the age of the child? Let us understand. That's also a direct pick from the lectures. I've just copy pasted. All right, to all the 100% sures, you got to learn a new concept. I've covered your first molar also. So now understand. Early childhood caries is often classified into mild, moderate, and severe forms based on the DMFT index. What is DMFT? It is decayed missing filled teeth index, right? Mild ECC is typically defined as the DMFT score of 1 to 3. Moderate is a DMFT score of 4 to 6, whereas severe ECC is 7 or higher. Now that is general, okay? Okay. Yes, there was an image about this thing. No, but see, what they've given is it is not mild ECC. Why it will not be mild ECC? Because they've given that the child is only 3 years old and the DMFT score is 4. So what happens? There is a general rule that if the DMFT score is greater than or equal to 4 at the age of 3, then it will mean that it is a severe ECC. At the age of 4, if it is greater than or equal to 5, then it will be severe ECC. And at the age of 5, if the DMFT score is greater than or equal to 6, then it will be severe ECC. So severe ECC has these particular things, okay? Okay. So we have In case there is no severe ECC in the options, there are rampant caries in the options, so you can go for rampant caries, because having a DMFT score of 4 at the age of 3 means it is something greater than moderate ECC. It is not just mild or moderate, it is severe, either severe or rampant caries, whichever, but it is greater than moderate if the age of 3, the DMFT score is 4. Is it clear? Okay, is it clear to everybody? You have to relate the score, the DMFT score, with the age of the child. Okay. All right, but at the age of, so you just remember this last line that I've written here, a DMFT score or greater than or equal to 4 at the age of 3, at the age of 4 if it is greater than or equal to 5, and at the age of 5 if it is greater than or equal to 6, then yes, then it is either severe ECC or rampant caries. Okay, it is not mild, it is not moderate. You have to go with something that is greater than moderate. If there is severe in the option, you go with severe. If there is rampant caries in the option, go with this thing. Okay, my God, so much discussion. Okay. Yeah. So the answer is because you are still not sure about this thing now, whether this was in the option or that was in the option. So if there is severe ECC in the option, you go for severe ECC. If severe ECC is not in the option, then you have to go with rampant caries, because you have to relate the age of the child with the DMFT score. That is it. Okay. Yes. Right. Okay. Next question is, identify the age of the patient based on this image. So, based on this image where you can see all the primary teeth are erupted, there is no permanent tooth that is erupted. So, based on this image, basically the child is going to be 5 years of age. Okay, the child is see, rampant is in mandibular anterior and not rampant means your maxillary and mandibular both are involved. Rampant does not mean that only the mandibular are involved. Mandibular will not be involved in most of the types of ECC, but when maxillary plus the mandibular are involved, then it is going to be rampant. So you can go for rampant in case there is mandibular and maxillary both involved. Only mandibular involved does not mean rampant. Am I clear, Amreen? Right? So what I'm trying to say here is in that question, don't look at which teeth are involved. Just try to relate the age of the child and the DMFT score. That is it. Okay? Okay. Yes. So the age here is 5 years of age. Okay. Right. The next question that I have recollected is, in a patient with age 7 years, primary second molar is extracted. So the space has to be maintained up till when the premolar erupts, or up till when the canine erupts, or there is no need of space maintainer, or you have to reduce space to accommodate the premolar. Right? So these 4 options were given. So basically, it is so, you just cannot do it without an X-ray generally, because every individual is different. But since the age is 7, it is generally advised to give a space maintainer till so in here what happens when the patient is 7 years of age, the permanent canine is not erupted. The premolar is not erupted. So first you will give a space maintainer, so that up till the permanent premolar erupts, because you are maintaining the space for the premolar. So the answer here is space needs to be maintained till the premolar erupts. Okay, so the answer here is A. Just give me a minute. Yes, the answer here is A. Okay, yes. So yes, till the premolar erupts. Question number 6 is, patient aged 4.5 years reports to the dental facility 6 months after the injury. Okay, tooth number 5-1. So tooth number 5-1 is right primary central incisor. The tooth is discolored. Obviously, 6 months have passed since the injury. The tooth is discolored. What does it mean? The tooth is discolored. That means the tooth is non-vital. What is it? The tooth is non-vital. So what is the best treatment plan? Can you do IPC? No. IPC is a vital pulp therapy. IPC is done when there is a scope of preserving vitality of the tooth. Can you do a pulpotomy? No. Should you go for an extraction? No, because we've read that anterior teeth need to be saved in order to prevent speech defects in children. So you do not go for an extraction. What you do is you do a pulpectomy. So the answer here is B, that is pulpectomy. All right. Okay. Now comes question number 7. So what is question number 7? While treating a patient for caries, the dentist switched from an aerator to a spoon excavator. Now this is kind of tricky if this was the question exactly. Okay. What I retrieved was the dentist switched from the aerator to a spoon excavator. That means he was using an aerator first and then he switched to the use of a spoon excavator. Was this the question exactly? Because if this was the question, it's an excellent question there. Okay, C, we have a C, we have a B. But just confirm it to me. Was this the language of the question? Yes, somebody, Amrin. Very good. It is positive reinforcement. It is positive reinforcement. Right? So it is not desensitization. Desensitization is when you use a less invasive method and gradually increase the intensity of invasiveness of the procedure. That is desensitization. Means first you'll do a simple checkup, then you'll use a hand scaler, then probably you will use an aerator, then you'll use LA. That means you are eventually increasing the intensity of the invasiveness. That is desensitization. But here, what did the dentist do? He was first using an aerator, then he switched to a spoon excavator. That means because of the aerator, the child would have been uncooperative because he was scared of the noise of the aerator. So what he did, because he was scared of the noise of the aerator, that means the aerator was acting as something that was not giving you the desired behavior. So what he did, he kept the aerator and he used the spoon excavator. So the child started cooperating. So the spoon excavator acted as a positive reinforcer. He used something that was, yes. So he used something that the dentist used something that actually helped in gaining the desired behavior. So it is 101% positive reinforcement and it is an excellent question, right? No, it is positive reinforcement because he switched to a spoon excavator. That means what is positive reinforcement? Presentation of a stimuli that helps in getting the desired behavior of a child. So what is the presentation of the positive stimulus here? It is the spoon excavator. Yes, so the same thing, Amal. Like he was crying, not cooperative because of the aerator. So he switched to the spoon excavator. That means he did positive reinforcement. Okay? Yeah, I hope you all got it. Is there any doubt why it is positive and not negative or desensitization? I'll be very happy to explain again. It's a good question. Right. So the next question is, a patient presented with a white lesion, how will you differentiate clinically? That's how I retrieve. Removal of negative stimuli shouldn't be. No, see, what he did in order to gain the positive, there is a negative reinforcer. है So what he did is he used the spoon excavator and removed the aerator from side. When he used the spoon excavator, the child started cooperating. So the presentation of spoon excavator actually gained the desired behavior. So it is an example of positive reinforcement using the spoon excavator. If the question would have been, a child is very uncooperative, he's crying, he's scared of the sound of the erotor, and he's not sitting on the dental chair, he's not letting the dentist do the treatment, what is the erotor an example of? So this is a negative reinforcement. The erotor is behaving as a negative reinforcer. But since they've told that he switched to a spoon excavator and now he's able to do the treatment, hence it is a positive reinforcement. Okay. Quickly, now the white lesion there. So here the correct answer is white spot initial caries will disappear on hydration, and the white spot lesion of hypoplastic nature is less affected by drying or wetting. So basically what happens, whenever there is an incipient lesion on the enamel, what happens, the enamel in that place is dehydrated, right? It is basically dehydrated, na? And hypoplastic enamel is what? It is internally, right? The enamel is hypoplastic. It is deformed due to hypoplasia. But initial caries means dehydration of the enamel. So whenever you wet an initial caries, the dehydrated pores will be filled by water again, and the refractive index of the dehydrated enamel will be again equal to a normal enamel, and it is going to look absolutely okay when you wet it. Okay, hence the initial caries on wetting always look like normal enamel, as if the initial caries have disappeared. Okay, so this is the difference between the initial caries and the hypoplastic enamel. You just need to wet the lesion and see if it is disappearing, that means it is initial caries. If it is not, then it can be a hypoplastic enamel. Okay. Okay. Chalo, done. What is B in Shobha Tandon? Just listen to my explanations. These are direct pick from the notes. I hope you no, positive reinforcement is presentation of a stimuli that helps in gaining. Like I'll give you an example. A small child, like somebody referred to Shobha Tandon, right? So in Shobha Tandon only there is this example given. A child who is 2 to 3 years old will not cooperate until the parents are asked to come and stand next to him or her, because the parents at this age act as positive reinforcers. So positive reinforcement means and a presentation of such a stimuli that will help build up the confidence, build up the desired behavior in a child. Okay, and negative reinforcement, it would have been if the question would have ended that the child is uncooperative with the use of erotor. Okay, so that is probably the dentist is probably waiting for some time to for the child to recover from the sobs and irritation and then using it again. But because he presented, and now the child is very comfortable with the spoon excavator, so because he's very comfortable with the spoon excavator, he'll be able to, last longer for the treatment. That is why it is like reinforcing a positive attitude by, jabki, look at, just concentrate on a point. The removal of caries would have been perfect with the erotor. But with the spoon excavator, the caries will not be removed ideally as well as it would have been with the erotor. But he introduced the spoon excavator so that the child relaxes, he finds less danger in the treatment, and he cooperates more. Okay, so presentation of the spoon excavator, even though it means not a very perfect treatment, is an example of positive reinforcement. Right, so I'm getting a lot of hundreds and all. I hope you people are understanding my explanation. Okay, right. No, it is Kabir, or it is not about rewarding every time. It is basically you do anything so that the patient establishes faith in your treatment. Okay, so that he comes back to you for a second appointment. That is positive reinforcement. You are instilling a positive attitude in a patient. That means it is positive reinforcement. So if he is able to get the caries removal done with the help of spoon excavator, Kabir, that means you are reinforcing a positive behavior. He might come back to you ki theek hai, he does not use that motor. he'll do it with a better instrument or something. So it is not always rewarding. It is, reinforcing an attitude so that he comes back to you for the second appointment. That is it. Right? Okay, question 9 wasn't. This wasn't, but somebody was telling me the first molar was absent. And who are those people who told me that there was unilateral loss of primary first molar? I have your question also, and somebody saying this isn't there. So the choice of space maintainer opted in case of loss of primary first molar would be, yes, it is band and loop. Very easy. There is loss of primary first molar. So what you will do, you will just place a band and loop there. So it is just band and loop. Okay. Did I tick the earlier ones? Yes, yes, yes. Okay. So question 9, it is just band and loop. Now we come to question number 10. A child has discolored tooth. His mother gave history of bottle feeding at night. What would be the diagnosis? Okay. Okay, we're still stuck with reinforcement. I'll take a special video, okay, for reinforcements and omission and all. Stopping the treatment would have been negative. But yes, stopping the treatment can be negative reinforcement. But that's what I'm telling. If it would have stopped there, negative reinforcement. But then he introduced a magical wand called the spoon excavator. That was positive reinforcement. Okay. I hope it is okay. Okay. Chalo. So, a child has discolored tooth. His mother gave a history of bottle feeding at night. What would be the diagnosis? So bottle feeding at night brings about nursing caries, here you have to go for mild caries because there is no tooth destruction that they have told. Yeah. Okay. Question number 9 and 10 में कुछ mix up है. Okay, Vicky, relax. Hypothetical question, but there is no harm in learning something new, is there? Yeah. There is no problem in learning something new. Yeah, you might have done wrong in some question, learn something new there. Right? Okay. Anyway, was not there. Okay, let's keep it then. Now we have a question number 11. I hope this was there. So it was an image-based question basically. There was a non-vital permanent maxillary central incisor tooth with an open apex and a large periapical radiolucency. Was this there? Question number 11. Question number 11 was, I hope it was there. There was a large periapical radiolucency along with adjacent mesiodens. What will be the treatment? So the treatment, because it is a permanent maxillary central incisor, okay, permanent maxillary central incisor hai, and it is non-vital, so you're going to go with apexification. So it is an apexification. Okay, now let us come to question number 12. Antibiotics that are contraindicated in children, undoubtedly they are tetracyclines. So you can give amoxicillin, you can give metronidazole and ciprofloxacin. Okay, that was discussed in endo. Okay, Ayush, गलत है तो आप मुझे सही question बता दो. I will cover it. Okay. 3 years having caries given and bottle feeding was there. Okay. So they did not ask you about the treatment. What did they ask? What will not be the treatment? Okay. If you are... Yeah, there is a safest also. So somebody told me this. And the next question is about the safest. If you want me to tell you why tetracyclines are contraindicated, I'll tell you. But the safest I have covered, yes. Which one is the safest drug in pediatric patients? So the safest drugs. Okay. So the safest drug out of these is amoxicillin. It is not tetracycline, not cefixime, but okay, but amoxicillin. All right. And then the last question that I was able to retrieve for pedo was a 1-day-old child is brought to the OPD with a tooth-like structure, probably in the lower anterior region. Please don't mind the language. Okay. The language can be a little jumbled up. Okay. We are not the ones who set the paper. So there's sometimes the language jumbles up in the retrieval part. Okay. So what should be the line of treatment? Okay, so the line of treatment, so this is a neonatal tooth. Okay, so neonatal tooth, because they have mentioned 1 day, according to what I retrieved, was if it is a 1 day old child, then it is a then it is a, sorry, natal tooth. So natal means a tooth that is present from birth, and neonatal means the tooth that is present, after birth, the tooth that erupts. Okay, so this is a natal tooth, and the natal tooth, the no treatment has to be done if if it is not creating any issue. A natal tooth is extracted only after the child, only if it is creating any type of issue, such as it is creating a rigor syndrome, or if it is if it is mobile, only then you extract it. Otherwise, if there are no issues with the natal tooth, you do not do anything, you just let it be. So the answer is B there. Okay, so yes, okay, so I hope you were able to answer the pedo questions. Itne mushkil nahi the. Please explain. Question number 9 to non-existent tha. Apramita. People said that there was no question number 9. To separate band and loop. Option 2 was reverse band and loop. Other two options I don't remember. Question is same, but options were different. हाँ, since birth मतलब वही natal tooth हुआ ना. मेरे को जो जिसने बताया that was 1 day old. So 1 day old means since birth only it will be Ajay. Yeah. Okay. Okay, great. So there are any doubts, you all know we have a nice close family of DBMCI. You know where to catch me for the doubts. You know we've covered almost everything that was asked in our notes, in our lectures. And still, if you can retrieve any more questions, anything else, so please, please, please get back to me with your doubts. All the very, very best. I hope you did very well with your exams. And let's hope for the best with your results. Thank you so much. Bye.
So a very good evening, everyone. So I'm Dr. Rajesh Gubba. I'm the general medicine educator. So I'll be just quickly discussing the questions of the general medicine of the MDS exam, what you had yesterday. All right. So let us start with the first question. Right. So the question is, a patient comes with a stab injury to the chest. And the very important pointers that they have given in the question is like the hypotension, there is like distended neck veins, muffled heart sounds, and the pulsus paradoxus. So what should be the immediate next step? Pericardiocentesis, needle decompression, chest tube insertion, and then the IV fluids. So now here, the very important pointers to tell the diagnosis here is, one is the hypotension, then distended neck veins, then the muffled heart sounds. So all these three, that is hypotension, distended neck veins, and muffled heart sounds, these are the features that you observe in case of the cardiac tamponade, right? And this we call it as the Beck's triad, right? So this we call it as the Beck's triad, okay? Right. Now, in case of this cardiac tamponade, what is the immediate treatment that has to be done? The immediate treatment that has to be done in patients with the cardiac tamponade is pericardiocentesis has to be done, right? Pericardiocentesis has to be done. And what about the other options? You take needle decompression. Needle decompression is a treatment in case of pneumothorax, right? So he did not mention anything about the breath sounds. So the needle decompression and as well as the chest tube insertion, both of them, they are the treatment options in case of pneumothorax. But so he did not mention anything about the breath sounds, like breath sounds are absent and all. So the features of the pneumothorax are absent. So we cannot go with option B and C. Now, what about the IV fluids, right? So in a patient with the cardiac tamponade, they will definitely present with hypotension. But if you give IV fluids, the underlying clinical scenario further will get precipitated, because in patients with cardiac tamponade, you will notice you will have right ventricular diastolic collapse. So if you give IV fluids, the venous return further increases and your right ventricle is in a state of a diastolic collapse. You cannot give the IV fluids, because even though if you give the IV fluids, it will increase the venous return. but the right ventricle is not, or right side of the heart is not in a position to take the IV fluid, right? So there will be backflow of the blood and there will be systemic venous congestion. So it is not the IV fluids first. So what you need to do is, like, you need to do the pericardiocentesis, right? No, it is not pneumothorax, okay? Because the pointers, like, if at all, if it is pneumothorax, what all should have been given? I'll tell you what all should have been given if pneumothorax was the underlying diagnosis. Number one, there should have been given as a sudden onset dyspnea, right? And number two, the second important finding that should have been given is about the breath sounds. So he did not mention about the breath sounds. So breath sounds will be absent in patients with the pneumothorax. Okay. Otherwise, if you take hypotension, will you have in pneumothorax? Yes. In tension pneumothorax, you can have hypotension. Do you have distended neck veins in pneumothorax? Yes, you can have distended neck veins in pneumothorax. Do you have muffled heart sounds in pneumothorax? Yes, you can have. If it is left-sided pneumothorax, you will have muffled heart sounds. But what is that one point which is making you to think it as cardiac tamponade is the pulsus paradoxus, right? So presence of the pulsus paradoxus, it is suggestive of your cardiac tamponade. It is not your pneumothorax. Okay. So that is the reason why the answer is the pericardiocentesis, but not your needle decompression or the chest tube insertion. Okay. Right. So that was like the first question. Now, next question. So bone marrow aspiration, it shows the empty bone marrow. What is this suggestive of? The aplastic anemia, thalassemia, and then pernicious anemia. So it is very simple and straight question. In case of aplastic anemia, you will have the empty bone marrow. Whereas you take in case of thalassemia or the pernicious anemia, what is that you will notice is you will have the hypercellular bone marrow. Right? You will have the hypercellular bone marrow. Okay. So the answer here is the aplastic anemia, right? Where you have the empty bone marrow. Done? Yeah, the answer is first option. Right. Then a female child patient complaining of pain and difficulty in swallowing. Right? Pain and difficulty in swallowing. She has fever and intraoral examination shows yellow-gray ulceration. Right? Shows yellow-gray ulceration. This is a very, very important point. The presence of yellow-gray ulceration. So this is suggestive of the herpetic gingivostomatitis, right? Presence of the herpetic gingivostomatitis. Now, what about the other options? Why the other options can be ruled out? So you take in case of measles, right? So in case of measles, you will have the Koplik spots, which are nothing but the tiny white spots. That is what you'll observe in case of measles. And what is the presentation in case of measles? That is cough, coryza, conjunctivitis. These are the features that you will have in case of measles, right? And why not the other option, that is the secondary herpetic gingivostomatitis? Now, what is given the age group? The age group of the patient is child, female child. Whereas if you take this herpetic secondary herpetic gingivostomatitis, this is commonly observed in adults. Right? This is commonly observed in adults. Yeah, any one of you, like, is this option present? The secondary herpetic gingivostomatitis, was it there? No, it was not. Okay, fine, no problem. Even if you remove also, right, the answer will be like your herpetic gingivostomatitis. And what was the fourth option? Any one of you, can you recall, like, what was the fourth option? Right, no problem. Like, anyways, we have the answer here. It is herpetic gingivostomatitis, right? And okay. Now, this is another very important question. So patient complains of excessive cough production, especially in the morning, right? Especially in the morning, okay? And there is also change in posture, right? That means your sputum production is getting changed with a change in the posture. And crepitus is heard on auscultation. And this is a very, very important point. That is, clubbing is seen. What is the most probable diagnosis? Okay, right. First point, it is, okay, the answer is bronchiectasis. Because among the options which has been given to you, Among the options which has been given to you, the only option where you have the presence of clubbing is bronchiectasis. In asthma, you will not have bronchiectasis. Chronic bronchitis, you will not have clubbing. And asthma, you don't have clubbing. And emphysema also, you will not have clubbing. Only in bronchiectasis, you will have the presence of clubbing. But there is one point which may give you a slight confusion. That is the expectoration in the morning. And the individual is also a smoker. What about the smoking history? Smoking history was there or not there? Smoking history, is it there or not there? Pulmonary tuberculosis also was given. No problem. Even if pulmonary tuberculosis is there, pulmonary tuberculosis will not cause clubbing. Pulmonary tuberculosis will not cause clubbing. Okay. So we can easily rule out the pulmonary tuberculosis, right? Okay. Achha, no smoking history. Right, fine. So still the answer will be the bronchiectasis, because among the options which are given, like you will not have clubbing in any of the option except for bronchiectasis. That itself make you the diagnosis as the answer. That is your bronchiectasis. Done? Right, chalo. Then we'll move on to the next question. So a child complains of pain in cheeks bilaterally since 5 days. Right. It's okay, Hridresh Kumar, even if it is smoking history there and sputum is present, still the answer is bronchiectasis. Okay, right. And on examination, there is bilateral parotid gland enlargement and tenderness with the increased serum lipase levels and as well as the amylase levels. So what is the probable cause? What is that you people have answered? That's what I was telling home forwards, like why the chronic bronchitis is not the answer. Because in chronic bronchitis, you don't have clubbing. In chronic bronchitis, you will not have clubbing. So that is the reason why chronic bronchitis is not the answer. Okay, right. Yeah, and yes. Yeah, so here the answer is mumps. It's a direct question because like on examination, there is bilateral parotid gland enlargement. And there is also elevated serum lipase and as well as amylase, which is a feature very much suggestive of your mumps. Okay. So I hope everyone is clear. The answer, fifth answer is A. Right. Now here you see very clearly, within how many days of development of sore throat should the antibiotic prophylaxis for the rheumatic fever be started? 5 days, 7 days, 9 days, 11 days. What did you people write? Yes, what did you people write? So the prophylactic antibiotic should be started for the rheumatic fever within 9 days. Right? It should be started within 9 days. Okay, it is not 5 days, it is not 7 days, it is 9 days. Right? So it is, so to prevent the acute rheumatic fever, the antibiotic treatment for the Streptococcus pharyngitis must be started within 9 days of the symptom onset. Within 9 days of the symptom onset. And by giving that antibiotic, like what is that you are targeting? You are targeting the group A Streptococcus, that is Streptococcus pyogenes. And what is that antibiotic prophylaxis that you will give? So either penicillin V if it is oral or benzathine penicillin G intramuscularly. And if the individual is allergic to this penicillin, then erythromycin or azithromycin should be given. Okay. So the answer is within 9 days. All right. Next question. Right. In which condition the prophylaxis is required prior to the dental treatment to decrease the chances of the infective endocarditis? See, almost all these questions are there in your notes and as well as in my recorded lectures. Prosthetic valve, hypertrophic cardiomyopathy, mitral valve repair, and isolated mitral valve prolapse. Right. So yes, what was the answer for the 7th question you people have answered? The answer is, yeah, very good. So it is the prosthetic valve. It is the prosthetic valve. Okay. So there are actually 4 indications where you will give prophylaxis for infective endocarditis before the individual is going to the dental procedure. One is prosthetic valve. Second is the individuals with past history of infective endocarditis, right? Past history with infective endocarditis. And the third scenario is the individual who had undergone cardiac transplantation Now he has developed valvulopathy. That is the third indication. And fourth indication for infective endocarditis prophylaxis is unrepaired complex cyanotic congenital heart diseases. Right? Unrepaired complex cyanotic congenital heart diseases. These are the four scenarios where you need to give the prophylaxis for infective endocarditis, like when the individual is going to a dental procedure. All right. So the answer is like A. Okay. And yeah, fine. Even okay, I'll come back to the fifth question later. I'll come back to that. Pancreatitis was in the option or pancreatitis was in the question? Yes, home words, Akriti and Prakash. Pancreatitis was in the option or the pancreatitis was in the question? Because, so you mean to say, okay. So this was like pancreatitis. But in case of pancreatitis, see, okay, in the options was the pancreatitis. But you have to understand that one of the complication of these mumps is the development of pancreatitis. So this pancreatitis cannot explain your bilateral parotid gland enlargement, right? Pancreatitis cannot explain the pain in the cheek, but the virus which is causing this mumps can cause bilateral parotid gland enlargement and can also cause the pancreatitis, right? So that is the reason why the answer is being mumps in this. Okay, right. Now, the next question. An old age male patient who is a chronic smoker shows the condition of the paraneoplastic syndromes. Shows the condition of the paraneoplastic syndromes with increase in the calcium level. So the most probable reason is insulin-like growth factor, calcitonin, parathormone-related protein. What is the answer? Yeah, very good, Muskan. So the answer is the parathormone-related protein. So, like, what exactly is the diagnosis here? I'll tell you. Chronic smoker shows the condition of paraneoplastic syndrome with increase in the calcium level. So what type of malignancy the patient has developed is the individual might have developed, right? The individual might have developed squamous cell carcinoma of the lung, right? And this squamous cell carcinoma of the lung is the one which will release the parathormone related protein, okay, or parathormone related peptide. And this parathormone related peptide, which is being produced by the squamous cell carcinoma as a part of the paraneoplastic syndrome, that is what is responsible for increase in the serum calcium levels. Okay, so the answer is the parathormone related peptide. Done? Right. And this is a very simple question, right? This should not be a problem for you at all. Which of the following hepatitis virus cause morbidity with pregnant female? Hepatitis A, B, C, and E. Right. So what is the answer here? The answer is the hepatitis E. So hepatitis E, this is the one which will cause the fulminant hepatitis in pregnancy. Right. So this is the one which will cause the fulminant hepatitis in pregnancy. Okay. Calcitonin will not increase calcium, Prakash. Calcitonin will decrease the calcium. Right? Calcitonin will decrease the calcium. Okay. Right. And you see the next question. A 15-year-old boy after traumatic injury complains of swelling in the joint, and he complains of recurrent episodes of such events many times since childhood. What is the underlying cause? And this should not be a problem at all. Very simple question, right? Immune thrombocytopenic purpura, disseminated intravascular coagulation, hemophilia A, Glanzmann's thrombasthenia. Right. So what is that? The answer is the hemophilia A. The answer is the hemophilia A. Done? Right. Yeah, very simple and straight question. This, I think no one should have a difficulty in this question. Right. And yeah, this was the other one. So a 56-year-old patient with multiple radiolucent lesions in the mandible shows the following on gel electrophoresis. So what is the condition? What is the condition? So what is the answer here? So the answer is none other than the multiple myeloma. Can anyone recollect what are the other options apart from multiple myeloma in this question? Yes, what was the other options? Multiple myeloma, and what about the other options? Okay, so thalassemia, then eosinophilic granuloma, and then amyloidosis. Okay, fine. But the answer is what? That is multiple myeloma. Multiple myeloma is that where you will have multiple radiolucent lesions. Okay, right. Now, the next question. So in a patient with leukemia, post-extraction, bleeding is expected due to increased leukocytosis, decreased clotting factors, deficiency of the calcium, platelet deficiency. What would be the answer? Right? So here, the individual post leukemia, the individual is having bleeding. The reason for that is the platelet deficiency. Because in case of leukemia, you have increase in the WBCs, even within the bone marrow. This increased WBCs within the bone marrow will replace the platelets, and that will cause thrombocytopenia. Right? That will cause thrombocytopenia. Okay. So the answer is D here. That is platelet deficiency. Then, right. And the few more questions, right? If I'm not wrong, there was a question on the topic of aphasia, right? Where the individual had the fluent aphasia and then neologisms were there, right? Fluent aphasia and neologisms were there. Which area of the speech is being affected? So anyone, which area of the speech is being affected here? So the fluency is maintained, but there is neologisms. So this is suggestive of Wernicke's aphasia. Right? So this is suggestive of the Wernicke's aphasia. Okay, right. In case of Broca's, what is that you will have is, in Broca's, you will have non-fluent aphasia. In Broca's, you will have non-fluent aphasia. All right. Okay. So, yeah, the answer is Wernicke's. And I hope you had one question on the Brown-Sequard syndrome. Yes, you had one question on the Brown-Sequard syndrome, if I'm not wrong. So, like the question, like where there is loss of proprioception. The question, if I'm not wrong, it is like loss of proprioception ipsilaterally, that is on the right side. And there is contralateral loss of pain and temperature. Right? Contralateral loss of pain and temperature. Okay. So, right. So what is the answer here? The answer in this question, loss of pain and vibration. Yeah, that's what. So loss of proprioception and as well as vibration. That will be on the ipsilateral side. That will be on the ipsilateral side. So loss of the proprioception and vibration on the right side, and loss of pain and temperature on the contralateral side. That is opposite side. Right? So the answer to this question will be Brown-Sequard syndrome. Right? And what were the other options given? What were the other options given for this? Okay, fine. So these were some of the medicine questions, right? And yeah, so these were some of the medicine questions. I have one quick session right now for the next 25-26 batch, right? So I'll just wind up the session. If you have any doubts in this recall, you can just text me on the Telegram or on the WhatsApp group which has been created. So I'll definitely answer you back once my class is done of this 25-26 batch. Okay, right. So thank you very much. And I'll just discuss if any other questions are due on the Telegram channel or on the WhatsApp.
Right, guys. So a very good evening to all of you. So I hope you people have done your paper well. So yeah. So we have come here for this discussion. So like if I say the overall level of the paper, I would say it is medium. The level of the paper is medium, and as expected, questions are mostly clinical questions. So the best part is this AIMS people or the NEET PG people, they're asking the clinical questions. So all questions for clinical. And one more thing is, there was a time when they used to ask questions which are irrelevant to the dentistry. But now they have started asking questions which are quite relevant to dentistry. That's why if a student has a good orientation of a subject and the student has actually practiced and seeing the patient, so it's easy for the student to mark the answers. Like he or she can easily correlate the things. So we are starting with pharmacology discussion, and I request you guys that you people also contribute in filling up the choices which we were not able to recollect from the students. So starting with question number 1. So there is a lag, like when I'm teaching and the transmission that is going to you. There's a lag of few minutes. So we'll try to adjust with that lag. So I'm just waiting over here so that you will come just to just come at the same level where I am right now. So question number 1, a 3-year-old child patient reported with pain and swelling in the jaw. So patient has got pain and swelling in the jaw, and there is a history of severe allergy. So here this word is very important, the history of severe allergy. So there is a history of severe allergy, and on examination, this is the apical abscess. Apical abscess is there. So they are asking which drug can be given. So guys, whenever we say there is an apical abscess, so we assume that there is a bony involvement. So we assume that bone is also involved. And when we say that the bone is also involved, plus the abscess is there, the causative bacteria can be gram-positive. So gram-positive bacteria like the streptococcus. So streptococcus is something that is involved over here. And we also have involvement of anaerobic bacteria. We also have the involvement of anaerobic bacteria, like we have a fusobacterium. So we can also suspect the patient may have the involvement of anaerobic bacteria like the fusobacterium. So we have the gram-positive bacteria, streptococcus. We have some anaerobic bacteria like the fusobacterium. And to cover this spectrum, we give penicillins. So penicillin is a medicine that will cover both. That will cover gram-positive infection, and that will also cover anaerobic infection. Now in this MCQ, cefixime is a 3rd generation cephalosporin. This is the 3rd generation cephalosporin, and these medicines which are 3rd generation cephalosporin, they are not effective. They are not effective against anaerobic bacteria. So this can easily be ruled out. So during our discussion also, then in our regular batch, I told you only generation 2 cephalosporins. Only generation 2 cephalosporins have activity against anaerobic bacteria. So cefixime we can rule out because the involvement of anaerobic infection is there. Now tetracycline, it cannot be given to children. So tetracycline cannot be given to children because the child is only 3-year-old. So when we give tetracycline to child or a pregnant female, the patient can have the problem of bones and the teeth. So bones and the teeth development problems can occur. That's why we don't give tetracycline to this 3-year-old child. And if we talk about erythromycin, erythromycin is a narrow spectrum antibiotic which is mainly effective against gram-positive bacteria. So this is mainly effective against gram-positive bacteria. And because of the narrow spectrum, this is also not effective against anaerobic bacteria. So here we have a drug, the medicine is clindamycin. So clindamycin is a drug which has a beautiful spectrum of covering gram-positive bacteria as well as anaerobic bacteria. So this will cover both gram-positive plus anaerobic bacteria. That's why the answer is clindamycin. And this thing we have discussed so many times during our regular batch also. I gave you one table also where I wrote the name of all antibiotics, and I told you against gram positive which antibiotics are useful, against gram negative which antibiotics are useful. So we made a table and we easily find out from that table the answer is clindamycin. That will cover gram positive, anaerobic both. So answer is B, Bombay. In patient of severe allergy to penicillin, we can give clindamycin here. Here, more important thing is like how to rule out the other options. That is more important to know, because mostly what happens, if I say this patient is allergic to penicillin and the patient has got only mild allergic reaction. So patient has got only mild allergic reaction. The first thing is this. Now, if the patient is not having a apical abscess, like the bones are not involved and anaerobic bacteria are not there, so abscess is not there. So if we don't have the abscess, then we don't suspect the patient is having the anaerobic bacteria, right? So for the mild allergic reaction, the answer would be the cephalosporins. So if there is a mild reaction and there is no abscess present, the answer would be cephalosporin. But here, because the involvement of bone plus the abscess is there, we also cover anaerobic bacteria by clindamycin. Now, the second question is very easy question. A child is having a toothache. The child is having a toothache. Which antibiotic is used? Which antibiotic is safe? So, guys, I just want to know whether this question is actually asked in the exam or not, because I don't think so. This is such a easy question. I don't think so. Please, NEET PG people will ask this question. The child is having a toothache. Which antibiotic we give to this child? So again, tetracycline is contraindicated in children. So this is cannot be the answer. And child is just having a toothache. So child is just having a toothache, and vancomycin is a drug which is always given by IV route. So this antibiotic is always given by IV route. And the second problem is this is only useful against gram positive bacteria. And we know that if the patient is having toothache, this may be an infection, and a tooth infection have involvement of both gram positive, gram negative bacteria, and also there is involvement of anaerobic bacteria. So tooth infection is caused by gram positive, negative, anaerobic. So here the vancomycin cannot be the answer. One is the patient has come to an OPD, just a toothache, and second is the vancomycin is not useful against gram negative bacteria, so this can be ruled out. Now here we have a amoxicillin and clindamycin. So out of these two, the amoxicillin is a better answer because this is safe. Amoxicillin is a medicine that is safe to use in children. So this is safe to use in children, as well as this is safe to use in pregnant ladies also. So the beta-lactam antibiotics like cephalosporin, amoxicillin are safe, and this medicine is useful against gram positive, gram negative, as well as anaerobic bacteria. So the penicillins are useful against, this is a broad spectrum penicillin. So this is the broad spectrum penicillin, and the broad spectrum penicillins are the one which are useful against both gram positive, gram negative, and anaerobic bacteria. But clindamycin spectrum is not complete. It is only effective against gram positive. It is mainly given for gram positive and anaerobic. So it is not a good antibiotic to be given to cover the gram negative bacteria. That's why in the previous question, if the patient is not allergic to penicillin, the answer would be, the better answer would be penicillin group of medicines, not the clindamycin. Because in the first question, we don't have any other option to mark. That's why we chose clindamycin. Otherwise, if I would be a doctor and I would have the complete options available, like if the patient is allergic to penicillin, right, and patient is having the apical abscess. So to cover gram positive, negative, as well as anaerobic bacteria, I would have given the levofloxacin plus metronidazole combination. So this will cover my gram positive, negative, and anaerobic infection. But here the option is not available. That's why we have gone to the least, not very preferable medicines these days, clindamycin, the question number 1. Question number 2, amoxicillin is a better answer to be chosen, right? So guys, in case you think the options were not these, there were some other options, just let me know, because I'm there with you on the chat box also. So I'm just reading your chat also. So in case you have, okay. So safest in child, safest drug in child. Yes, so amoxicillin is safe to use in children. That's why I told you. This is safe to use in pediatric patient. Even the clindamycin is also safe. There is no issue in using clindamycin. The only problem is clindamycin has a maximum risk of pseudomembranous colitis. So this medicine is not a very safe antibiotic, not for children, but for everyone. That's why clindamycin utility has been declined. Clindamycin utility has been declined because this medicine has the maximum risk of pseudomembranous colitis. So safest of all. So safest. So I just want to modify this question. Which antibiotic is safest? Which antibiotic is safest for the child? So this is what the question has been asked according to the, yes, the doctor name is Mr. MR. So he has told us that safest drug was asked. Dr. Sanjana also has said the same thing. Muskan, thanks for this. Okay, so instead of vancomycin, according to one doctor, there is a drug of ciprofloxacin. So guys, again, if the drug is ciprofloxacin given, so ciprofloxacin is a good antibiotic which has a good activity against all bacteria, gram positive, negative. So this is useful against gram negative mainly, also gram positive, but ciprofloxacin is not useful against anaerobic. It is not useful against, is not a good antibiotic to be chosen against anaerobic, first thing. Second, ciprofloxacin is not safe to use in children. So this medicine can cause cartilage. This medicine can cause cartilage and the tendon rupture. So this medicine can interfere with the growth of cartilage and tendon. So if a child is taking fluoroquinolone, and if a child has got a mild trauma, like even after the mild fall, like trivial fall, mild trauma, the child can have the rupture of tendon and cartilage. That's why ciprofloxacin is not the safe antibiotic to be chosen over here. So here the best answer is, here the best answer is uh, amoxicillin. Yes, yes, ciprofloxacin is not a good antibiotic for anaerobic bacteria, guys. So the best fluoroquinolone for anaerobic bacteria that will cover positive, negative also, it's moxifloxacin. So had it been moxifloxacin, so that would be a drug that we can choose, but because this is a child, safety issue is there. That's why the best answer here is amoxicillin, right? Question number 3, a large amount of patients worldwide are now showing the complication of acute kidney injury due to an adulterant in pharmaceutical agent. Which of these is? So the answer is, guys, uh, diethylene glycol. So diethylene glycol. So there was an incident that happened in January 2024 that happens in Kazakhstan. So there were around 300 children developed acute kidney injury. So there were cough syrup. So there was some cough syrup that that was exported to Kazakhstan, and people used those cough syrup that was manufactured in India. So those cough syrup were manufactured in India, right? And these cough syrup are exported to Kazakhstan and children used over there. And this was published in newspaper. And after that, many issues were raised against the Indian pharmaceutical manufacturing techniques for companies, and many companies were banned because of this reason. So this question was based on current affairs. So apart from studies, you should also be aware of the current affairs. So this was the agent diethylene glycol, which is the causative factor here. Okay, so according to one student, ethyl alcohol was not in option. Ethylene glycol was there. So guys, ethylene glycol is generally not mixed with the drug. So ethylene glycol is itself is a toxic agent. So this is a basically the antifreeze agent. So that is added to the car and the vehicle's engine. So you know that, like people who live in Canada, people who live in cities like Eskimos, like where there is a lot of snow. So what is the problem there? Like they have this freezing of the water in their car engines, and once the water will freeze in their engine, the engine circuit will get choked up, right? That's why this will lead to problem in their car. So what do they do in these cold countries? They put some antifreeze agent. They put some this antifreeze agent so that the water remain liquid, that is not going to freeze, and that's why the car engine can be saved. But this is very sweet in taste, and the children can drink this sweet liquid when they go to garage, and this will lead to toxicity, right? So diethylene glycol. So this is based on the current affairs. So I mean, if you are fond of reading newspaper, you should be knowing the answer. And according to one student, there is a drug given, one compound given, sulfotannic acid. So sulfotannic acid is one more compound given over here instead of ethyl alcohol. So guys, ethyl alcohol is not the thing that we add in the drug. So ethanol, ethyl alcohol is nothing, just ethanol. Like you people will take it to tonight because you're just over with the exam. So you people have the party season going on. So this is something that you can take it in any amount. That is not going to damage your kidney. That will damage your liver, right? So this is ethanol. Tonic we call it, right? So question number 3, methylamine is also used for the manufacturing of the drug. It's one of the chemical. But this was the current affair. This was asked, right? Okay, now question number 4, a patient reported to the OPD with persistent cough and fever. So guys, this was the question that we discussed so many times during our lecture. Right, so I told you this question was asked in NEET PG. So this was the NEET PG question asked in INS CT also in the medical side, and the same question is repeated in the dental. The patient has got a whooping cough. Patient is a case of whooping cough, and when the patient is a case of whooping cough, So you have to give the medicine, and the drug of choice for whooping cough is azithromycin. So we can give the macrolides. So macrolides can be given. Azithromycin is safest to use in children, and this medicine will act on 50S ribosome. So here the answer is azithromycin. This is a case of whooping cough. Now you people have to answer me, like according to one of the student, sir, this azithromycin was not given in MCQ. So was this so, guys? Can you please confirm me? Can you please confirm me, were these four options there, or there was something else? So did they ask the same question, like the drug is acting on 50S ribosome, and they also gave you azithromycin? So this was a question that we also put in our grand test, as well as in various NEET mock test, where, because these were the questions asked in NEET PG exam last year. So there is a high chances, high probability that this is asked in your exam also. Yes. Okay. So according to one student, yes, this is what I'm saying. So according to one student, azithro was not there. Guys, no problem. In case azithro was not there, so erythromycin is there. If the erythromycin is there, that's also can be the answer. But that is also a macrolide. According to one student, the drug is chloramphenicol. So one more drug that will act on 50S ribosome. So the drug which will act on 50S ribosome. So this medicine can also, this medicine was there according to some students, but this medicine is not very safe drug. This drug is outdated because this medicine can cause bone marrow suppression. So because of the bone marrow suppression, nobody use chloramphenicol these days. So in case erythromycin, azithromycin, clarithromycin, these options were there. So that would be the answer because they belong to the same class. Chloramphenicol also act on 50S ribosome, but this cannot be the answer because this medicine has a lot of side effects, and rest of the medicines will not act on 50S ribosome. So rest of the medicines will not act on 50S ribosome. Okay. So Dr. Rupinder Kaur is saying tetracycline was not there in the option. So Rupinder, can you please update us which was the option? So one was azithromycin, second was streptomycin, one was chloramphenicol. So was the fourth option penicillin? The penicillin was the fourth option, guys. So four options I have written in front of you. I'm just highlighting the fourth option: azithromycin, streptomycin, penicillin, chloramphenicol. So these were the four options according to you. Okay, you people are already exhausted, so you are not in a mood to discuss the question. Okay, fine. I agree with you guys. You people are not in mood to discuss, but I have to fill the choices also, na. Without your help, I cannot fill the all choices because you were the one who have actually faced the exam. So I have to fill the choices, and in case you answer it fast, it's good for you. Okay, this question we discussed so many times during our lecture. Yes, so this patient has got anaphylaxis. So patient has got anaphylaxis, patient has got allergy, and we discussed so many times which drug is life-saving. The answer is epinephrine. So epinephrine is a drug of choice. Epinephrine is a drug of choice for this anaphylactic patient, anaphylaxis. So in case you have any doubt, please ask. So this was clear-cut question of anaphylaxis. Right. So, epinephrine, adrenaline is the answer of this MCQ. So, is there any doubt here? Okay, so adrenaline. Okay, instead of epinephrine, the option was adrenaline. That's fine. So this was an option. So adrenaline is the answer of this question. Okay. Okay. Now there is a question, and I emphasize this question many a times in our lecture also, that this group of medicines is very important. That is new group of anti-diabetic. We call them SGLT2 inhibitors. Medicines are known as SGLT2 inhibitors. These medicines can cause various infections like UTI and all. And these medicines can also increase the risk of euglycemic diabetic ketoacidosis. So medicines can increase the risk of euglycemic diabetic ketoacidosis by causing the loss of glucose in the urine, and the various things we discussed during the lecture. So this was a clear-cut question. The question was based on side effects of SGLT2 inhibitor. That's an anti-diabetic medicine. So any doubt in this question? Or the options were same? Okay. Instead of this, they have given you canagliflozin. So instead of this, they have given you the name of the drug, canagliflozin. So canagliflozin name was given. Okay. Anything else in this question, guys? Okay, according to Dr. SSJ, this question was clinical question. They have given you one clinical statement. So one clinical statement is there, and according to the clinical statement, you have to make the diagnosis that the drug is causing the side effect like diabetic ketoacidosis. So they must have given you the pH value. The pH value should be coming down below the 7.2, and the urine ketones. urine ketones may be positive in this patient. So urine ketone positive, pH is 7.2. So this was the thing they can ask you. Okay, name was not given. So according to Nikesh, the name is not given, only the group was given. Okay. Okay, fine. So this was the answer of this question number 6. Question number 7, a patient who is having a known case of epilepsy came for the dental treatment and patient is currently on carbamazepine therapy. Now, which drug is advised to prevent the toxicity of carbamazepine? So guys, basically here you have to choose a medicine which is a liver enzyme inducer. So here you people have to help me. If I give liver enzyme inducer, that will induce the carbamazepine metabolism. So if you know the name of any drug given in this MCQ, that's a liver enzyme inducer, and that medicine can enhance the metabolism of carbamazepine, and this is the uh, logic that we can use to prevent the toxicity of carbamazepine. So can you please help me out? What were the options? So one was tramadol. One option was tramadol. Second option is erythromycin. So erythromycin is liver enzyme inhibitor. Erythromycin is liver enzyme inhibitor, so that will not cause. So that is liver enzyme inhibitor. And anything else you know? Okay, question was which drug is given that will cause toxicity? That will cause toxicity. Okay, then the answer is clear cut. Which drug must be advised to avoid? The answer should be which drug is advised to avoid the toxicity of carbamazepine? Then the answer is erythromycin. So erythromycin is the drug that's a liver enzyme inhibitor and that will inhibit the carbamazepine metabolism. So this will inhibit the carbamazepine metabolism and that's why there is a resultant toxicity of carbamazepine. So that will increase the risk of toxicity. It's based on liver enzyme inhibitor. The question was from General Pharma and we discussed this logic like the names of liver enzyme inhibitors so many times during our lecture. So that was something that they have asked this time. Question number 8, which drug is safe to prescribe in a patient having a peptic ulcer? So this was a repeated question. PYQ question was asked last year also. So which drug is safe to use in peptic ulcer? Answer is paracetamol. Now last time they asked you the COX-2 inhibitor. So last time they asked you COX-2 inhibitor. So COX-2 inhibitors are those medicines which end with the word COXIP. So they are also safe. So patients of peptic ulcer disease, acetaminophen, COX-2 inhibitor, these medicines are safe to use. So the answer here is C. So question number 8, answer is C. Okay, yes, here we have a peroxicam. So Dr. Mohika, peroxicam is there in this MCQ. Yes, PCM is the answer. PCM will not cause acidity, so it is safe to use in patients of peptic ulcer disease. Okay, so patient has got refractory periodontitis and there is a drug that we can use and the medicine act on 30S ribosome. So patient of refractory periodontitis and the medicine act on 30S ribosome. So guys, let me tell you for refractory periodontitis, like if a patient has got stage 1 and 2, patient has got stage 1 and 2 periodontitis. So we prefer to use the medicines like tetracyclines. So we prefer to use medicines like tetracycline, doxycycline. So tetracycline, doxycycline, minocycline. So these are the medicines like tetracycline, doxycycline, minocycline. These medicines can be given by local route. So preferably they are given by the local route than over the systemic route. But if a patient has got the complicated periodontitis like stage 3 and stage 4, then the answer would be amoxiclav. So amoxiclav would be the answer here. So amoxiclav is mostly given for stage 3 and 4 and cephalosporins can also be tried. But here they have specifically asked the medicine that act on 30S ribosome. So here we don't have any doubt, like amoxicillin clearly ruled out. So amoxicillin clearly ruled out and clindamycin does not act on 30S. So these two medicines are ruled out because they will like amoxicillin is cell wall inhibitor. Clindamycin is acting on 50S ribosome. Now streptomycin is an IV drug. This is an IV drug and we don't use aminoglycoside. Although this medicine act on 30S ribosome, but we don't use streptomycin for dental infection because they are the narrow spectrum antibiotic. So because of the narrow spectrum, we don't prefer to use streptomycin because periodontitis caused by many bacteria, which include positive, negative, anaerobic bacteria. That's why the answer cannot be streptomycin. Here the answer will be tetracycline, right? Because I don't have any other option. Only tetracycline is given, so that is something that I would mark. So in case they have not given the 30S word, in case this 30S word is not there, the answer would have been the amoxicillin. So if the 30S word is not there, refractory periodontitis, amoxicillin will be the better answer. But they have given 30S. That's why I mean the answer would be tetracycline. So in case guys you think the question was not asked, there were some other options, let me know. Question number 9, answer is A. So for you people, I have learned these terms like periodontitis. What is periodontitis? So I've just gone to the anatomy of this teeth and then find out what is periodontitis, what is a periapical abscess and all. So a child reported with fever. The question is, the child reported with fever, abdominal pain since 2 hours, and patient gave the history of accidental ingestion of 10 tablets of paracetamol. So which antidote is used? So this is quite easy question, straightforward question. N-acetylcysteine is the answer. So here you people have to tell me one thing, whether they have given 10 tablets or 4 tablets. According to some students, only 4 tablets were there. According to some students, 10 tablets were there. And what were the other options? What were the other options asked in this MCQ? One was N-acetylcysteine, second was naloxone. What were the other two options? What were the other two options asked in this MCQ? Anything? Any other option you remember? Like apart from N-acetylcysteine, naloxone, anything? Okay, 10 was given. So not the 4 tablets, it was 10 tablets. 10 tablets were there. Okay. So in case you try, you can recall the options later on. You can just message me. Okay, one was diclofenac. Diclofenac. Diclofenac is not an antidote. There must be a name of some antidotes given. Maybe some flumazenil, digibind, or sodium bicarbonate. These kind of name may be given in your exam. Okay, yes, sodium bicarbonate. Yes, this is what I wanted to know. So sodium bicarbonate is given. So sodium bicarbonate is given. Okay. In case you remember the other fourth one, then just let me know. Question number 11. A female reported with curdy milk like lesions. So this question we discussed so many times during our lecture. Like I asked many students to repeat this answer in after me and during my lecture also. So the patient has got oral thrush and they asked you which drug is used. So this was the question asked in NEET PG exam. So this was the NEET PG 2023 question, and they have asked you which drug is given by the local route. So the clotrimazole. So we discussed so many times that clotrimazole is better drug than the nystatin. So the one option was nystatin, not the neomycin. One option was nystatin. So clotrimazole is better than nystatin to be marked. So this was a local drug topical agent that we used for the treatment of oral thrush and oral candidiasis. So clotrimazole is a better answer. The other options were nystatin, fluconazole, and gracophilvin. So our best answer is A, clotrimazole. Question number 12. A patient reported with uncontrolled bleeding after heparin therapy. So patient was given as a known case of MI. So patient was a case of MI and you used heparin during its CABG. So CABG is open heart surgery. So you're doing the open heart surgery for this major heart attack, that is a myocardial infarction, and you used heparin during CABG because you want to prevent the clot formation. Now patient has got the severe bleeding. Now what is the antidote of choice? So the antidote of choice is protamine sulfate. So antidote of choice for heparin is protamine sulfate. Vitamin K is an antidote of warfarin. So vitamin K is an antidote of warfarin and protamine sulfate is an antidote of heparin, because during the MI surgery, that is a CABG surgery, we use unfractionated heparin, or if we use any other heparin, the antidote is protamine sulfate. So that is the best answer to be marked over here. So in case you can recall the other options, just let me know. Like what were the other options given? So protamine sulfate, vitamin K, what were the other options given? In case you can recall, just send it to me. Okay, guys. Question number 13. A patient presented with electric shock like pain in the right midface, which stays for a few seconds. No other local cause is elicited. So this is a case of trigeminal neuralgia. You can easily find it out. Now, which drug would you prescribe? So guys, you know that, okay, here the factor 8 is given. So factor 8 is given over there. So factor 8 ko to guys we only use in hemophilia. So factor 8 we only use in factor 8 deficiency hemophilia. It has nothing to do with anticoagulants. Anticoagulants are those which are inhibitor of factor 2 and 10. So there's nothing to do with that. Right. So guys, here the drug of choice for trigeminal neuralgia is carbamazepine, oxcarbamazepine. And apart from that, we don't generally require to use any other drug. But still, there are 3 medicines which are found to be effective in clinical trials. So, like I would not say it is given in your textbooks. It is given in clinical trials that we can try gabapentin, baclofen, and lamotrigine. So there are 3 medicines that is found to be effective. One is baclofen, one is lamotrigine, and one is this gabapentin. 3 medicines apart from carbamazepine that is found to be effective in some clinical trials. So on the basis of those clinical trials, we can prescribe any of this medicine. So here this is a confusion whether we have to mark baclofen or the gabapentin because they have given both here. So maximum studies have been done for gabapentin. So maximum studies or maximum experience of doctor in clinical trials as well as in day-to-day practice is with gabapentin. Solely based on this reason, I will go for gabapentin. Like if you ask me, sir, ki why gabapentin, why not baclofen? So there is no answer for that because most of the uh, studies have been done on gabapentin, not on baclofen and lamotrigine. That's why like gabapentin, I will choose as the best answer here. So gabapentin is the answer of this MCQ. Question number 14 is based on to choose the best therapy for anaerobic infection. And guys, you must be knowing we have discussed these kind of things during our lecture also, like how to choose the best medicine for a given bacteria. So for anaerobic bacteria, above the diaphragm. So above the diaphragm, we have a presence of gram-positive and anaerobic bacteria. So above the diaphragm, we have gram-positive and anaerobic bacteria. And below the diaphragm, we have gram-negative and anaerobic bacteria. So above the diaphragm, we have the presence of gram-positive and anaerobic bacteria that will go from the tooth and go down to the to your upper part of the abdomen. So here we choose clindamycin. So clindamycin will cover gram-positive and anaerobic, and gram-negative and anaerobic is best covered by metronidazole. So if you give the combination of these two, this will cover the whole spectrum. This will cover the all type of anaerobic bacteria. So here the best answer is metronidazole plus clindamycin. Now guys, please remember guys, penicillin and cephalosporin, they belong to the same group. So they belong to the same group and we never combine two medicines of the same group. And I told you cephalosporins are not effective against anaerobic bacteria. First is penicillin, cephalosporin, they belong to same class and we don't combine two antibiotic of the same class against a particular infection. Same thing applies to piperacillin. Cefoxitin is not useful against anaerobic bacteria, right? Okay, cefoxitin is generation 2. Generation 2 cephalosporin, this is effective. But again, they belong to the same class. So piperacillin and cefoxitin, they belong to the same class. They are the beta-lactam antibiotic. That's why they cannot be the best answer here. Now, tetracycline, azithromycin, they are not effective against anaerobic bacteria. They are not the good option to be chosen against anaerobic bacteria. So this is completely ruled out. So here the best answer is C. So question 14. Yes, so we discussed this question during our PYQ lecture also as well as in other lectures. So this is like comparatively easy paper if you have a clinical orientation, like how to treat the patient. Now there was a patient of some mental illness. So patient of some mental illness given to you and you started a drug and that drug has caused agranulocytosis, and this is something that we discussed so many times during our lecture. The medicine's name start with C and there are three medicines that start with C and that will cause agranulocytosis, right? Okay, question number 12 may, according to one student, one option was desmopressin. So this is what I was thinking, ki they cannot give you vitamin K and warfarin together. So one of the option was desmopressin. One of the option here is desmopressin, factor 8, vitamin K and protamine sulfate. So answer was protamine sulfate. Okay, so here the clozapine is the best answer. Clozapine can cause agranulocytosis. Here is the homework for you people. You have to tell me the names of other two drugs which start with C and can cause agranulocytosis. Although you people are not in a mood to discuss this thing. So why the dental pulp is not anesthetized? Not anesthetized because whenever we have the inflammation, there is a acidic environment. So this will lead to acidic environment, and because of the acidic environment, your medicine will become more ionic. So anesthesia drugs are the local anesthetics are basic in nature. They are alkaline in nature, and because they are alkaline in nature, they become ionic in the acidic environment, right? So why there is no anesthesia? Because the medicines will become more ionic. So medicines will become more ionic. So this is the increased ionic form of local anesthetics in the inflamed area. And now the medicine cannot take entry. Medicine cannot take entry in the medicine cannot take entry. So medicine cannot take entry in neuron. So medicine cannot take entry in exolemma. So medicine entry in the exolemma is not possible when the medicine is ionic. Now there is a yes, this is what I want to say, Dr. Gargi Gandhi. Like if the option is given as anionic, if the option according to some student, this is an anionic form. So anionic form is the something that will take more entry in the nerve. So if the patient is having inflammation, acidic environment is there, the drug is not anionic, the drug is more ionic in nature. So if the option may anionic form was there, so the best answer would be this one. Because in inflammation, we have the more blood supply. And because of the more blood supply, whatever drug you will inject, the blood will take away that drug towards the veins. You want that local anesthetic should remain at the place where you inject them. But if there is a more blood supply, the arteries will bring the blood and take away the drug towards the veins. So we don't have any local anesthetic left at the inflamed site. That's why this would be the best answer in case the option D may, the word is anionic instead of the ionic. So yes, I can see the many students are saying that the word given was anionic, right? Yes, the inflamed area is acidic in nature. Okay, so answer would be D if it is a ionic word, or the answer would be C in case the word is anionic. Okay. Question number 17. Okay, again they have given the same question mid phase few seconds. So answer is gabapentin. So trigeminal neuralgia, gabapentin is the answer that we have already covered. Now again they have given the same question. Inflammation is there in the pulp. So what is the biological reasons? Again we have discussed this question already, right? Now question number 19. A patient with osteoporosis. A patient with osteoporosis. No. Dream space. This we are presuming that in inflammation the pH will decrease. In inflammation the pH will decrease, right? Now question number 19. A patient of osteoporosis wants extraction of the teeth and she is on bisphosphonate therapy. So this we discussed so many times. Also discuss I also shown you some photographs of the osteonecrosis. So after long-term therapy of bisphosphonate, patient can develop the osteonecrosis, and that's why there is a concept of drug holiday. So the concept of drug holiday is there. So osteonecrosis would be the answer of the side effects of the bisphosphonates they have asked. Now, according to some students, they have also asked you the organophosphate poisoning. So I just want to know, did they ask you the organophosphate poisoning? Like they gave you cholinergic symptoms. So they gave you cholinergic symptoms, and after giving you cholinergic symptom, they ask you like what is the treatment. So can you please confirm me? Did they ask this question from you or not? Did they ask this question of this organophosphate poisoning, guys? Anyone? Can any one of you confirm me? Did they ask this question? No one is able to answer here now. No, this question was not asked. Okay. Was there any question? The patient is taking itraconazole. Patient is taking itraconazole and they ask you which infection patient would be suffering from. So was there any option like histoplasmosis? So was there any option like histoplasmosis? Itraconazole is a drug which patient is taking. So yes, so organophosphate poisoning, did they ask you farmer in the field? Any history of farmer in the field? So whenever you have the history of farmer in the field, organophosphate poisoning can be there, right? So organophosphate poisoning, farmer in the field, something like that. Okay, so itraconazole is an antifungal of choice for histoplasmosis. So this is the drug of choice for histoplasmosis if this was the answer, if this is given in the MCQ. And there is one question like HIV patient where the CD4 count is 180 and candidiasis is there. What is the drug of choice? CD4 count, fluconazole, Dr. Nikesh. So HIV positive patient and the CD4 count is 180 per cubic millimeter. So which antifungal will you give? Answer is fluconazole. So fluconazole is something that we give. Okay, guys. Now let's wind up this session. We have already covered all the questions which are asked in pharma. In case you think there is some question which is not covered by me, so just message me and let's be in contact. So my WhatsApp number is this, so you can directly contact me on this number in case you have any doubt. Plus, I would also be there with you on the Telegram group of DBMCI, so you can also directly tag me over there. And I hope, guys, you people have done really well in the exam because most of the questions we have already covered in the exam. Now it's time to have fun, enjoy your life. Don't lose this time also. Take care, guys. Oh, wait. We have a one more session of Dr. Monalisa. So after ending this anatomy session, then go for that. Okay. Take care, guys.
Hello, everyone. Hello, everyone. Am I audible? Okay, so am I audible? Is the screen clear? Let me just check. Just a minute. The screen is not coming. Okay. So yes, I'm audible. Is the screen is clear so that we can start the session? Okay. Dear students, just wait. Okay. Okay. So let's see how was anatomy, everyone. I am audible. Let me just check. Hello. I am audible. Okay. Okay. So let's see. Okay, so we will start the session. Oh, can we start? Okay, so let's start with the first MCQ. Some setting issues. He's doing, but the students are. Cut short answer. Okay. Students wants to cut short. Okay. The screen is different on this YouTube session. I am seen at the top. Ask Vishu, is it okay? Okay, sure. I will cut short. Sure, I will cut short. No worries. Only the thing is that the screen is not set. Okay. Just setting. Just 1 minute. Okay, anyway, so what was the first question? Yes, so everyone is okay. So this was about, which of these is not a branch of facial nerve? So students are telling deep petrosal nerve. So absolutely correct, dear students. Yes, you are absolutely correct. The correct answer is deep petrosal nerve. So why not the other one, posterior auricular nerve to stapedius and coda tympanic nerve? Why not? Because these are the branches of facial nerve. So yes, these are the branches of facial nerve. So that is the reason. Now, if you will see, actually, this was exactly the image which is showing you all the branches as you can see in this diagram.
Answer. Hello. Hello. Answer.
Okay, am I audible? Okay. Why the screen is not? Okay. Okay, dear. So now we can start. Is it okay? So basically, this was the first MCQ. So once again, we are starting. Okay, dear. So yes, so which of these is not a branch of facial nerve? This was a very easy question, has been done in the lecture classes also. And everybody is knowing the answer, that is deep petrosal nerve. What is deep petrosal nerve? It's the plexus around the internal carotid artery. And this is not exactly the branch of facial nerve. As we have already discussed here, and we can see the greater petrosal nerve, the coda tympanic nerve, the posterior auricular nerve, the terminal branches, all these are the branches of facial nerve. So basically, if I talk about posterior auricular nerve, this is a branch from the facial nerve, which is giving innervation to the muscles, occipitalis, belly of occipitofrontalis and posterior auricular muscle. And it is also giving sensory innervation to external acoustic meatus. Now, deep petrosal nerve, now just moving to the next MCQ, deep petrosal nerve, if I talk about, it is forming internal carotid plexus. And these deep petrosal nerve will join with the greater petrosal nerve to form which nerve? Viaden nerve. What is the other name of Viaden nerve, my dear student? It is also called as the nerve of pterygoid canal. Now, my dear students, I have just taken the screenshot of the lecture where I have used this image and I have described about the lesions and the branches of facial nerve. So good to go. Mohit and everyone, can we go to the next MCQ? I think everyone has marked this as the correct answer because so many times we have done in the PCTs and in our lectures. So can we move on to the next MCQ, everyone? Okay. Okay. So now question number second. Superior bulb of internal jugular vein is related to which part of tympanic cavity? Whether it is the roof, whether it is the floor, whether it is the medial wall and lateral wall. So basically for this question, you have to know about the middle ear cavity and its walls. Okay. So what you have marked, my dear students? So if you will see the schematic diagram, if I will show you a schematic diagram of middle ear cavity, you can clearly appreciate that the relation of superior bulb of internal jugular vein will be lying in which area. So what you have marked, the correct answer will be the floor. Is it okay, everyone? Have you marked it floor? Raghav, Sandra, Abhishek Kumar, everyone? Lateral wall? No, dear, it's the floor. It's the floor. So let me show you this diagram. So everyone, this is a schematic diagram. So this is the lateral wall. which is formed by the tympanic membrane. This is the anterior wall. So basically, we can see laterally what has been opened up. So we have got the yes, floor is right. So you can see here, this is the floor. As in this diagram, this is the floor and this is the roof. So if I talk about the roof is formed by a thin plate of bone, which is basically related with the cranial fossa above. And the floor is formed by the bulb of internal jugular vein. Okay, you have skipped one tough one. Yeah, because this is basically ENT question, more of it. But it's okay. They have asked one of the questions. So floor, if anyone has marked the floor, they have got the right answer. Okay. So basically in this question, we have to know the wall. So we know anteriorly, if I talk about the middle ear cavity, it is related with the tubal opening auditory tube tensor tympani muscle. Laterally is the tympanic membrane. Roof is formed by the thin plate of bone separating it from the cranial fossa. And in the floor, we have got the internal jugular vein. So basically, the right answer will be floor. Floor is related to the bulb of internal jugular vein. Okay, dear? Dr. Armendru, so let's move on to the next question. Question number 3. I think this is the easy one. A 22-year-old boy is coming with the lacerations to the face after being hit by a broken glass bottle. His vitals are stable, but he is unstable to close his left eye and unable to smile on left side. So which of the following structure is injured? Okay, so we have got submandibular, parotid, masseter, and temporalis. Okay, approximately we have got many of the anatomy questions which were easy. So how you find the anatomy exam papers? What was the question of anatomy which you were finding it easy or difficult? I think most of the topic and the question was repeated one only. Topic was repeated only. This middle ear cavity was the new one. Yes, Dr. Armind has given a right answer. Yes, parotid. Actually, this is again related to the facial nerve, and we know that facial nerve is traversing inside the substance of parotid gland, and from the anterior border of parotid gland, the terminal branches of facial nerve emerges. Easy except the 2. Yes, you are right. Yes, that is right, the answer. So basically, the right answer is parotid gland. It can be the temporalis, masseter, and submandibular because facial nerve is related and traversing through the parotid gland. Yes, dear. So structures, if I talk about the structures which is lying within the parotid gland is the arteries, it's the vein, and is the nerve and the lymph nodes. So facial nerve and its 5 terminal branches will be emerging out from the parotid gland. We have got retromandibular vein and we have got the terminal external carotid arteries which is traversing. So this image is showing you the relation of the parotid gland, and you can see these all zygomatic, upper, lower, buccal, marginal, mandibular, cervical. These are the branches of facial nerve which is emerging out from the anterior border of parotid gland. Okay, so here the planes has been shown, the arterial plane in which you can see the maxillary artery, superficial temporal, the retromandibular vein, and also the facial nerve traversing inside the parotid gland. Now, I just want you to show the images which I have clicked from the notes. If you remember in the notes, I have shown you the cadaveric images, and you can see the parotid gland has been retracted and the facial nerve, as you can see in this diagram, is traversing inside the parotid gland. Yes. So here also you can see this is the outline of the parotid gland here. PG for the parotid gland, and the facial nerve is emerging out. This is again taken from the notes. And we know that the terminal branches of facial nerve is giving innervation to the muscles of facial expression. So as in the image, they have told that the patient has got not the ability to close the eye. That means the muscles around this eye, orbicularis oculi, and all are injured because facial innervation is affected. Same way, the muscle around the mouth and also the smiling muscles, the laughing muscle, all these category of the muscles are affected because they are getting innervated by the terminal branch of facial nerve. So basically, Bell's palsy is the case in which you can see the patient drooping of eyelid, not able to close the eye, and the corners of the mouth is drooping. So this is a case of facial nerve palsy. Okay. Now, innervation of the facial muscle has been shown, and actually I am taking this from the notes. Again, this was the image taken from the notes where the terminal branch of facial nerve emerging out from the parotid gland and giving innervation to the muscles of facial expression. So same images. I think most of you have given the answers. Yes, the answer here is the parotid gland. The answer here is parotid gland, my dear students. Question number 3, parotid gland. And these are the images which is taken from the screenshot taken from the notes which I have described in the class. So all these we have covered, and I hope everyone has marked it right. This is the case of Bell's palsy. As the students are very exhausted, so I will quickly explain the question. So let's move on to the question number 4. Pre-traumatic nerve supply of first pharyngeal arches. All of you, please mark Gaur Khan. Yes, Kareem, I am making it brief. Don't worry, I am making it brief. So just question number 4. What is the answer which you have marked? The correct answer? Yes, next question has come up. And the correct answer is coda tympanic nerve. Yes, Saurabh Swaraj has given the, and this has been explained in the class taken by me. And I will also show you the screenshot of the class where we have talked about the pre-traumatic branch. So we know that each of the pharyngeal arches has got pre-traumatic and the post-traumatic nerves. And basically, if I'm talking about the pre-traumatic nerve, the pre-traumatic nerve of the first arch is the coda tympanic nerve. So for this, I would like to show you an image here where you can see basically, yes, you can see coda tympanic nerve is the pre-traumatic nerve of the first arch. This image is taken from the notes where we have talked about the coda tympanic nerve being the pre-traumatic nerve of first arch. Okay, so it's very important. And we have also discussed this table in which the muscles, the nerves, and the skeletons and the ligaments of all the pharyngeal apparatus has been done. So yes, Sandra, everyone, a thumbs up goes for you. So I think in anatomy was very easy for you, only except the one question. So let's move on to the next. Now, a child is being operated for neural tube defect. The dura and arachnoids are around the spinal cord, only the arches. So many of the students has told me only the vertebral arches was exposed. So the student has told me the vertebral arches was only the defective, that's all was okay. Okay, so basically if you remember, there is a condition which is called as spina bifida, where there is improper. So if I talk about the condition of spina bifida, there is improper closure of posterior neural pore. Posterior neuropore. Okay. So basically, these were the option. If you want to add on anything in this option, my dear students, if you want to add on any thing in this option, yes, Dr. Arme, absolutely the spina bifida is correct. Because if I talk about the severity of the effects. So I remember in the last year, there was a question about anterior and posterior neural pore closure timing was there. That was 25 days and 28 days. Now the question is about the defect. So basically, if I talk about the spina bifida occulta, it is the most mildest form of the deformity, which is due to the improper closure of the posterior neuropore. And here also, the well intact dura and arachnoid is there around the spinal cord. Only the defect is the mildest form where the failures of the vertebrae are there. So if the question is saying failures of the vertebrae, so the right answer will be spina bifida. So you can see these are, so this is the case of A, this is spina bifida, where only the defect is in the vertebrae. If I talk about the another one, that is the meningeocele, where the meninges extend out, but the spinal cord is still intact. Meningeominal seal is a condition where the spinal cord and the meninges both are exposed, and the myelocystis, this is the most severe form condition where the entire neural tissues are visible outside. The entire neural tissues are visible outside. So yes, if I have to mark the right answer, and I hope everyone has marked it right, that right condition is spina bifida. Yes, dear, I'm making it brief. Don't worry. I'm just ruling out the option. I can understand you're exhausted. I'm just making it brief. Yes, dear. Okay. So this was, again, I have taken this image. This was the image from the notes, from the class notes. And we have already covered the congenital defect of the nervous system, where the defective deformity of the closure of the posterior neural tube, which we have discussed. Okay. Yes, dear. Can we move on to the next MCQ? Question number 6. Yes, my dear students are very much exhausted. Okay, so the question number 6. A patient had an episode of loss of consciousness and the CT scan revealed a brain tumor. After regaining of consciousness, the patient eye has got unilateral downward and lateral deviation with drooping of the eyelid. So here the key factors are eyelid droops, eyelids are drooping, and the eye is seeing down and out. Down and lateral means down and out. Which of these are affected by the tumor? Okay, yes, the correct answer is oculomotor nerve. And again, this was discussed in the cranial nerve class. When I has taken the class of cranial nerve, I have told you about the oculomotor nerve supply, oculomotor nerve and its extraocular muscle being supplied. So basically, extraocular muscle is supplied by the oculomotor nerve, except the lateral rectus and superior oblique. So the sign and symptoms which has been shown, basically lateral rectus is moving the eye outward laterally and superior oblique is still functioning. So we have got the right answer, that is oculomotor. The presenting feature is unilateral lateral deviation, oculomotor nerve is damaged. As we know, the nerve is controlling the eyelid dilation, pupil constriction. So all these signs and symptoms which has been given has the right answer, oculomotor nerve. Other options are wrong. Why optic nerve is wrong? Optic nerve can't be the right answer because if it is injured, the patient will have defective vision. Facial nerve is also not the right. Facial nerve is injured, then the person will have a Bell's palsy or drooping of the face on one side. So this is also wrong. And this is from the class notes where this is exactly the class notes in which I have discussed about oculomotor nerve supply and their damage, as you can see. This is the reason, and I have clearly shown you what will happen. This is again from the class notes, screenshot taken from the class notes, where I have shown you what are the features of oculomotor nerve injury. Ptosis, down and out, patient is unable to abduct dilated pupil. So all these signs and symptoms was already given in the option. So the correct answer is oculomotor nerve. Next, okay, next question. So moving to the next question, question number 7. Okay, Rohit. A child with unilateral cleft lip is born after full-term gestation. Failure of fusion of these is the cause of the condition. So A, lateral process with maxillary process, medial nasal process with maxillary, frontonasal process with maxillary, medial nasal process with premaxillary segment. Actually, numerous times we have discussed, this has been asked repeatedly in the previous year, and we have discussed already in the class when I was discussing about development of face, palate, and the lips. And the right answer is, already discussed. Yes, the right answer is medial nasal process with maxillary process. Absolutely correct. Yes, absolutely correct, dear. Medial nasal process with maxillary process is absolutely correct answer. Question number B. Yes, dear. Yes. So that the right answer is medial nasal process plus maxillary process. Absolutely correct. So here you can see this is the case of unilateral cleft lip, and the right answer. This is again taken from the notes. And already in the notes we have discussed this, and all of you have marked it right. So can we move on to the next MCQ? Question number 8. A patient is planned for a elective partial thyroidectomy. Few hours after the surgery, she complained of difficulty in swallowing and aspiration into airway. On examination, there is loss of sensory innervation above the level of vocal fold. Which of the following is injured? Already moved here. We have moved to the next question. Question number 8. So yes, question number 8, please mark the right answer. Above. Yes. So yes, here Dr. Armin. No, Dr. Armin, it's not C. It will be internal. Yes, B is the right answer. Why? I will tell you. B is the right answer. External laryngeal. If I talk about external laryngeal nerve, it is wrong. Why? Because it is supplying only one muscle, cricothyroid muscle. Internal laryngeal is giving innervation to the upper part of the larynx, which has been asked. Recurrent laryngeal nerve is also wrong because it is giving innervation to the lower part of the laryngeal cavity. Lingual is not in, it is giving innervation to the tongue. It is not in relation to the vocal cords. So basically the right answer is B, and I have already told you about this. See this image. You can see if I'm talking about external laryngeal nerve, it runs with superior thyroid artery. Recurrent laryngeal nerve runs with inferior thyroid artery. But this was already done. And internal laryngeal nerve is the right answer. The previous year PCT is also, which I have framed, where I have given you this question. And we know that internal laryngeal branch of superior laryngeal nerve, B is the right answer because it is giving sensory innervation to the lower part of the vocal cords. Is it okay? Yes. Yes, upper part. Yes, dear Abdul Karim, upper part of the laryngeal cavity sensory innervation is by internal branch of superior laryngeal nerve, and lower part of the vocal cavity sensory innervation is by recurrent laryngeal nerve. So here upper part of the area sensory innervation was involved in the vocal fold. So basically the right answer is internal superior laryngeal. Is it okay, everyone? Raghav, Abdul, Anshu, Shreya. Okay, can we move on to the next? If the question is about lower part of the laryngeal cavity sensory innervation, then it is recurrent laryngeal. If the question is about laryngeal cavity upper part sensory innervation affected, then the answer is internal laryngeal branch of superior laryngeal nerve. Okay, so the right answer is B. So the right answer is B. Okay, dear. Now coming to question number 9. Which artery passes between the roots of auriculotemporal nerve? This was an easy one. Which artery passes between the root of auriculotemporal nerve? Middle meningeal, accessory middle meningeal, deep temporal, inferior alveolar. This was an easy one. We have already discussed the mandibular nerve and its branches. We have discussed trigeminal nerve in detail, and we have discussed about its branches, ophthalmic, maxillary, mandibular. And the right answer is middle meningeal. Yes, absolutely right. Middle meningeal artery. Yes, dear. Middle meningeal artery is the right answer. I would like to show you this image also. So you can see in this image, this is the auriculotemporal nerve, and it is looping around this artery. And what is this artery? This is middle meningeal artery. So you can see auriculotemporal nerve is looping around middle meningeal artery. Yes, absolutely correct. Easy one. And this is again the screenshot. This is again the screenshot from the class taken, where we have already discussed about auriculotemporal nerve winding around a loop, which is forming a loop around the middle meningeal artery. Can you see this loop? This is the loop. This is the loop around which artery? Middle meningeal artery. Easy one. Can we move on to the next? Question number 10. After a collision with the dashboard of a car in a road traffic accident, clinical and radiographic examination reveals injury to inferior alveolar nerve. So we know that inferior alveolar nerve is a branch of mandibular nerve, and which muscle will be affected or paralyzed in this condition. So very easy one. Again, this was the question taken. So that means cranial nerve is a very important topic. Yes. The right answer for question number 10. So all of you write question number 10. Right answer will be mylohyoid. What will be the right answer? Mylohyoid. So basically not geniohyoid, because basically geniohyoid is getting innervation via C1 carrying the fibers of hypoglossal nerve. Stylohyoid is supplied by facial nerve. Hyoglossus is supplied by 12th cranial nerve. So mylohyoid is the right answer. And this is again the question from mandibular nerve. So I can see that facial nerve 2 question has been asked. Oculomotor nerve 1 question, mandibular nerve another 2 questions. So basically cranial nerves has become a very important topic. So geniohyoid is primarily getting innervation from hypoglossal nerve along with C1. And this is the image where you can see this is the if you will see this image, I am enlarging it. You can see this is inferior alveolar nerve, which is giving innervation to nerve to mylohad. This is again the screenshot taken from the notes. So this is again the screenshot taken from the notes, which I have taken in the class. And you can see nerve to mylohad is the right answer. Mylohad. Yes, Shreya, you are absolutely right. Coming to question number 11. Muscle responsible for power stroke of TM joint. Muscle responsible for power stroke of TM joint. Superior lateral pterygoid, inferior lateral pterygoid, temporalis or medial pterygoid. So actually, this was a question where few explanation as a very important power stroke question has been asked. And if I talk about most important point about this question, power stroke, if I have to choose one of the option in this image, so I will go with the option of medial pterygoid. No, dear. What I feel is that if I have to choose one, so basically power stroke are the muscles of mastications. And if I have to go with one of the answer here, I will definitely tell you about. So basically what happens if, basically what happened, medial pterygoid, I will mark as the most correct answer, medial pterygoid. Because medial pterygoid and masseters are the power stroke muscles. If I talk about, so basically these two muscles are causing mainly the depression, and also the temporalis is causing retraction. So so if I have to choose one, I will go with medial pterygoid, and masseter was not in the option, so I will definitely go with the medial pterygoid muscle. Medial pterygoid muscle. So what you have marked, my dear students? Let me just check with the students. This was slight confusing one. So if masseter was there, so I am getting multiple medial pterygoid. So I am getting multiple options. If masseter was there, then the masseter is the right answer. And if medial pterygoid was there, then medial pterygoid is the right answer. Both was not there. Masseter was there. Okay, if masseter was there and not medial pterygoid, then you can mark masseter as the right answer. Okay, so medial pterygoid is primary muscle of power stroke for the TM joint. Why? Because it elevates and protrudes the jaw. Other muscles like masseter also contribute, but crucial action is the medial pterygoid muscle. No, dear. If I have to choose one, here the superior and lateral pterygoid, it's not included primarily as a power stroke muscle, because it also has got another function of lateral movement, protrusion, and opening of the mouth. I think you are getting confused with another question which was about the trismus muscle. Okay, not this one. So if the option is lateral pterygoids and if the option is medial pterygoid, then go for medial pterygoid. If medial pterygoid is not there and masseter is there, then go for masseter. Is it okay? Okay, Dr. Armendra Singh. So I have given you the answer. Masseter is there, then go for masseter. And if masseter is not there, medial pterygoid, then go for medial pterygoid. Okay, can we move to the next one? So different students are telling different options. Okay, I got this as the option. With the students, I got this as the option. So among this, we will go with medial pterygoid. Both masseter and medial pterygoid are correct, but if you have to choose one among the option which I have framed, then go for medial pterygoid. If medial pterygoid is not there, then go for masseter. Can we move to the next, dear? Dr. Armand, Gaur, Dr. Johan, can we move to the next one? Okay, let's move on to the next question. Next one. So this is the notes. This is the, okay, then go for masseter. Yes, Devang Patel, then go for masseter. This was again an image taken from the notes where we have discussed about the action of each individual muscle. Okay. So yes, Dr. Nikhil and Anshu, we will go to the next MCQ. Yes, as soon as possible. Okay, sure. Why not? There was one question about superficial lash injury to the neck causing air imbalance due to the injury. Okay, the option is external jugular, common carotid, subclavian artery, and jugular venous plexus. So basically, the most important reason of air imbalance, if I have to choose one among the option, I will go with external jugular vein. Why? Because external jugular vein is just lying in the roof, which is covered by the investing layer of deep cervical fascia. So common carotid artery is not in the posterior triangle. It is an anterior triangle. Subclavian and jugular venous plexus can also be the right answer. But if I have to choose one among these both, external jugular vein is a most important reason. External jugular vein is the most correct. Why? Because external jugular vein is superficially in the neck and it is more penetrable to injury. So it is the most superficial one in the roof of posterior triangle, and it is more important reason to get the reason of air imbalance. So air will go inside and will lead to air imbalance. Okay, you left this one. Yes, Prashant. It is clearly written in the grace, no doubt about this. So I think superficial injury of neck is causing air imbalance and external jugular vein, already known to you. And this is again the image which I have taken from the notes, where you can see this is exactly the external jugular vein. This is exactly the external jugular vein. And in this diagram, you can see external jugular vein is lying more superficially in the posterior triangle of the neck, which is the reason of air imbalance. Who reads grades anatomy? Is it okay? So we have done with all the 12 MCQs of anatomy, which I got. So all the best. And I think 80% or 90% of the students has given all anatomy correct answer. So yes, God bless you, and praying for you to get a better rank in the examination. All the best and keep studying. So can I just end the session? I think next session is Dr. Srishti Jaiswal ma'am or Dr. Abraham ma'am. Is it okay? So can I end, my dear students? Can I end the session? All the best, my dear students. Okay, so we have done with the anatomy MCQs. Yes, God bless you, and hoping for the best result. Anatomy question was very easy, except the one about the middle ear cavity. Thank you. All the best. God bless you. Thank you.
Hello, good evening, everyone. So, can you guys can see me and hear me? So, I am live on the YouTube chat. Okay. So, yes. Okay. I've got the thumbs up from you all. So, I'll start with the yes, Rohit. Okay. Good evening, everyone. So, I'll start with the NEET MDS 2025 NEET PG exam. So, first of all, you guys tell me how was the paper with respect to oral pathology? Are you guys satisfied with the exam or not? Now, as far as I know, the question, the pattern, yes. Okay, so everyone is replying yes. So, as far as I know, the pattern of the question, since we have discussed all the questions in the class, and also I had shared with you all a rapid revision which was shared by me 2 days before. Okay, so I think all the questions was from that topic except two questions. That was one question which had come from the syndrome, and one question which I'll be discussing. Okay, that was slightly little bit off the track, but then still it was discussed in the class. Okay, so pemphigus we all have discussed so many times, and I have given you in the INI series, in the GT series, I have given so many times the question. Okay, so the first question was, a pathology shows intraepithelial split because of the loss of adhesion between the cells. Okay, the cells, they are showing that they are swelled up. Okay, and there is a hyperchromatic nucleus, which is the most common pathology. So now you guys tell me what should be the answer of this. I am live on the YouTube chat. Okay, I'm seeing all your yeah, I know you guys have been watching the session since morning, so I'll be very quick. Okay, so let's have this rapid rewind of yesterday's exam. Okay, so you guys tell me what should be the answer for this. Totally exhausted. Okay, now Saurabh is totally exhausted. Yes, everyone is so right. So the answer is A, right? So we all know this. Now a 40-year-old male patient shows ulceration in oral mucosa, conjunctivitis, and there is a HLA-B51 positive, which is the most probable syndrome. Now, this you would have also done in oral medicine and radiology. 1 second. Yes. This was done in oral medicine and radiology, that is B51 positive. ठीक है, and there is a ulceration in the oral mucosa, conjunctivitis. Okay, this shows the triad, which is the, and what is the option? This is Behcet syndrome. So majority of you have marked right. Okay, that is 2B. Okay, Depayan is saying that he was waiting for my session. Okay, yes, I'll be very fast. Okay, I'll be very quick. Chalo. Now the third question, even I want to finish this session, okay, very fast. Now 60-year-old female patient, she had a painful urination, and she also had ulceration in mouth, vagina, conjunctivitis, shows adhesion of the bulbar and the palpebral conjunctiva. Okay, histopathology shows again there is a split between epidermal and the connective tissue. So as we know that pemphigoid shows the split between the epidermis and the connective tissue. What is the suspected disease? And also they are saying there is a ulceration in the mouth. Okay, so generally which pemphigoid, which pemphigoid is this? It is mucous membrane pemphigoid, also called as symmetrical pemphigoid. Okay, now this question. Okay, now I would be saying, by looking at the histopath and the question which they have mentioned, it is slightly different. Okay, but I'll explain you what, अगर ये question है तो क्या आंसर होगा, अगर ये question है तो क्या आंसर होगा. Other option was Sjogren syndrome. Okay, then also no problem, dear. This marker is only positive for Behcet's syndrome, right? Chalo, let's have a look on this question. Now, first of all, what you have to see in this question, 16-year-old female patient. That means this disease is occurring in the second decade of life. Okay? Then the patient has undergone the radiographic examination and there was a unerupted canine. Okay? तो अभी हमारे दिमाग में एक clarity है. ठीक है? कि what they want to ask. ठीक है? Which odontogenic tumor they want to ask. The tooth was surrounded by a unilocular radiolucency surrounding the crown. पहली बात तो second decade of life. Then what is, there is an unerupted canine, along with that there is a unilocular radiolucency. Histopathological examination. Now see, see this, I have got the histopathological examination. Yes, everyone is so right. This is adenomatoid odontogenic tumor. Okay. Now अच्छा मुझे ये बताओ, adenomatoid odontogenic tumor का histopathological finding क्या होता है? क्या होता है? It is a rosette pattern or the world appearance. ठीक है? But I cannot see any rosette pattern of the world tumor. This is much more of a, I can see that calcifying epithelial odontogenic tumor. But when we mark MCQs, okay, we have to mark the best option, right? But in COT, first of all, it is seen as a mixed lesion. ठीक है? तो ये जो भी है ना, this will be seen as radio opaque along with radiolucency. So this will be a mixed lesion. Okay. But in our question, they have mentioned that it is surrounded by a unilocular radiolucency. ठीक है? So the answer for this question is, as per they have mentioned in the question, it should be adenomatoid odontogenic tumor. ठीक है? CEOT में क्या हिस्टोपैथोलॉजिकल फाइंडिंग देखते हैं हम? कौन सा हिस्टोपैथोलॉजिकल फाइंडिंग देखते हैं सीओटी में? Lizzie Gang's rings दिखते हैं, right? But also CEOT, first of all, it is most commonly seen in mandibular third molar ramus area. Along with it, it is seen more in, what kind of lesion it is seen? It is seen as mixed radiolucency. It is not seen as, and also we can see multilocular radiolucency. ठीक है? Unilocular radiolucency anterior में, that to unerupted canine. तो canine में तो AOT must होता है. ठीक है? That to second decade of life. ठीक है? Is everyone clear? Yes. Lizzie Gang calcification. Yes, right. Now tram-like calcification, ये तो सबको पता है. ठीक है? This you would have done in oral medicine and radiology. It is seen in Sturge-Weber. ठीक है? अभी now there were two questions. ठीक है? There were two questions. Now some students are saying कि मैम एक question fusion पे था, एक question concrescence पे था. There were few set of students, they are saying that both the questions were from fusion. Okay, but now what the question which I have got, I'll tell the answer according to that. Okay, now the first question, a patient complain of crowding and a small teeth. ठीक है? अच्छा, crowding हो गया और small teeth है. On examination the patient has mixed dentation. तो generally fusion जब होता है तो it is more commonly seen in mixed dentation. ठीक है? One mandibular incisor is larger in size. Now the radiographic images shows two crowns. मतलब दो crown है and a single pulp chamber. That means they are saying that it is a fusion. ठीक है? ये fusion है. ठीक है? Fusion में क्या होता है? दो teeth but join हो जाते हैं. Gemination में क्या होता है? One teeth but it splits into two. The other is germination. Acha, okay, Amrinder. ठीक है, we will have a look on the question which I have got. If you guys feel that this was not the question, you can just mention in the comment box. Okay? चलो, अब दूसरे क्वेश्चन पे आते हैं. ठीक है? A patient complains of. अब मैं बताती हूँ तुम्हें क्या बोल रहा है इस क्वेश्चन में. ठीक है? The question which I have got. A patient complains of one unerupted tooth. ठीक है? अगर मान लो इसको मैं थर्ड मोलर मानती हूँ. ठीक है? चलो कनाइन भी मान लेते हैं, एंटीरियर मानते हैं. वो टूथ अनइरप्टेड है. ठीक है? ये अनइरप्टेड टूथ है. नाउ द एडजेसेंट टूथ इज स्लाइटली लार्जर इन साइज. अच्छा, दोनों seems both fusion only. Okay, for that we will have to check the question. ठीक है? According to this, now radiographically, हाँ, the adjacent teeth is large in size. Adjacent teeth थोड़ा सा ज्यादा erupted है और larger भी है. ठीक है? Adjacent tooth is larger in size. Radiographically, अब radiograph देख रहे हैं तो there are two crowns and two roots. ठीक है? तो अगर हमारे पास दो क्राउन है और दो रूट है, ठीक है, that means two separate crowns, two different roots. Okay, that means there are two different tooth basically. Okay, so what can be the option? It is not gemination, it is not fusion, no, it is not dilaceration, it is concrescence. Now there is one more type of concrescence where the tooth is joined via crown also. Okay, ठीक है, crown से भी ऐसे concrescence होता है. ठीक है, it is not always that it will be fused from the root. Okay, so according to this, I think that this is concrescence. The question according to this question. ठीक है, now I think there was a one more question about the odd land bodies. Okay, odd land bodies. Now see, odd land bodies जो होते हैं, these are not actually, odd land bodies में दोनों होते हैं. ठीक है, lysosomes भी होते हैं और राइबोसोम्स. तो हम ऑडलैंड बॉडीज को कभी ये नहीं बोल सकते that these are modified lysosomes or these are modified ribosomes. But if you have to choose one, so it is more seen as lysosomes. Okay, so the answer will be lysosomes for this. Okay, the answer will be lysosomes. I think this is very clear. Okay, now the child patient, तो first of all ये बोल रहे child है. ठीक है, child patient complains of increased salivation, premature loss of teeth, loss of hair in patches, rashes seen on skin. What is the reason? ठीक है, तो generally arsenic toxicity जो होती है, ठीक है, it is seen in child patient which is less than 5 years of age. ठीक है, लेस क्राउन इन टीथ. अच्छा चलो, मान लो जो भी क्वेश्चन में दिया हो, ठीक है, हमें ये तो पता है ना कि अगर एक टूथ लेस है, एक टूथ लेस है टोटल आर्च में से, ठीक है, n-1, देन इट इज अ फ्यूजन. जेमिनेशन है तो अगर एक टूथ पर दो में स्प्लिट हुआ और एक लास्ट टूथ दिख रहा है, ठीक है, एक लास्ट टूथ दिख रहा है, तो वो क्या होगा? जेमिनेशन. वो क्या होगा? जेमिनेशन. ठीक है, ये तो हमें कंसेप्ट पता है, राइट? आंसर्स टू द प्रीवियस टू आंसर. कौन सा बेटा? एमए गौर. Now, a 60-year-old female patient with vesicular bullous lesion on the tongue, vagina, palpebral and bulbar conjunctiva, ये अपन ने देख लिया. This is mucous membrane pemphigoid. Mucous membrane pemphigoid. Now, the last question for today's recall. Okay, 50-year-old male patient, CD count is less than 200, has a white non-scrapable lesion on the lateral surface of the tongue. ठीक है, the causative agent responsible. Now I have discussed this question many times, so I can say that all the questions were from PYQs along with all the questions. अच्छा, अगर वन लेस टूथ होगा, ठीक है, तो कॉन्क्रेसेंस नहीं होगा. ठीक है, कॉन्क्रेसेंस नहीं होगा. ठीक है, तो दिस इज, can anyone tell me, 50-year-old male patient, CD count less than 200, has a white non-scrapable lesion, the causative agent is Epstein-Barr virus. Can you tell me the number? I have marked everything. See, this is arsenic. Okay, this are called concrescence. This is fusion. Okay, and this is Sturge-Weber syndrome. This is adenomatoid odontogenic tumor. And this question, this is again mucous membrane pemphigoid, Bessett's, and then we have pemphigus vulgaris. Okay. Okay, so this finishes the oral pathology recall. Now I'm saying this, whenever I do recall, I say in all my sessions that this recall is not for the students who have already given the paper. Okay, this recall is for those students who are going to give this paper, because this paper will tell you that what is the pattern of the question. Okay, and also for the students who are going to appear for the INI paper next. Okay, so knowing the pattern of the paper is very important, because you should know that what you have to study. Okay, because pemphigus vulgaris, all these questions were taught again and again. Okay, so even if you have not studied the whole skin pathology, but if you have studied the pemphigus vulgaris, if you have studied the lichen planus, then you will be able to solve the MCQs. Okay, so knowing the pattern of the question is very, very important, right? Yes, so this finishes your oral pathology recall, and I wish you all bestest of luck. Okay, everyone, please be connected with me. Even in the future, if you guys have any doubt, if you are in any matlab, if you don't know what to do, then you can always connect with me. Okay, आई विश यू ऑल बेस्टेस्ट ऑफ लक. और अभी एग्जाम खत्म हो गया है, डोंट कोई लोड वोड लेने की जरूरत नहीं है. अभी 2 दिन तो एकदम चिल करो, रिलैक्स करो, ठीक है. बाकी जो भी रैंक आएगा, इट इज नॉट अंडर योर कंट्रोल. ओके, सो अभी तो बस बढ़िया खाओ पियो ऐश करो, ठीक है. चलो, आई विश यू ऑल बेस्टेस्ट ऑफ लक. आई थिंक द नेक्स्ट सेशन इज ऑफ डॉक्टर अभिरामी मैम. ओके, सो आई विश यू ऑल बेस्ट ऑफ लक. चलो, बाय बाय, गुड नाइट, बाय बाय.
Hello, everyone. Very good evening to all. So I can understand how hectic all of you are, just saying the chat messages. So first of all, is the audio visual fine? Are you able to can you, if you can message on the chat box? Are you seeing my image and the slides? Yes, if somebody can just reply. Okay, nobody is replying. Yes, good evening. Home for words. Are you seeing the screen? Because I'm not able to see the screen. Are you able to see the screen? Video and the audio is fine? Yes. Okay. Everybody says yes. Okay, little fast. Sure. I can understand. Just not more than 10 minutes. Quickly we'll finish. Physiology. So in physiology, I think almost all questions were from concept-based things, which we had discussed in the class and in the notes and also in the videos. So quickly to the session, except I think 2 questions which were more related to biochemistry. Other than that, almost all the questions we had discussed as such in physiology. Yes, quickly we'll do that. The first question, I think it was about a patient who presented to emergency after a road traffic accident. Right side. So just see the findings. On the right side, there is loss of fine touch and vibration. So one side, there is loss of fine touch and vibration. But on the opposite side, left side, there is loss of thermal sensation and pain. So pain and temperature is lost on the other side. What is the most plausible diagnosis? Yes, very simple question. It was about Brown-Sequard syndrome. So if fine touch and vibration are lost on one side, pain and temperature is lost on the other side, typical presentation of Brown-Sequard syndrome. So this we had discussed in our class itself, clearly about Brown-Sequard syndrome. So quickly, I'll just go through this. If let's say this is the right side, for example, and this is the left side of the body, if one half of the spinal cord is damaged, if this half has been damaged, there is a damage here. What are all the clinical presentations of the patient? On the right side of the body, the dorsal column fibers, they go into the spinal cord and they ascend into the medulla, cross in the medulla to the other side. So you can see that on the right side, dorsal column sensation will be lost. And dorsal column carries fine touch and vibration. Not only fine touch, vibration, proprioception, joint position, so many other sensations. Since in the question, fine touch and vibration were given, on the right half of the body, fine touch and vibration will be lost. What about the other side? From the left half of the body, so we have the other one, spinothalamic tract going into the spinal cord, but spinothalamic tract crosses in the spinal cord itself. You remember, spinothalamic crosses in the spinal cord itself. So it crosses like this and goes like this. So on the opposite side, pain and temperature will be lost. So that was the question on Brown-Sequard syndrome. Right side, fine touch vibration lost. On the left side, pain and temperature is lost. The second question, patient fell down from the bed. On examination, there is loss of complete vision from the left eye. Whenever there is loss of complete vision on one eye, this we call it as monoocular blindness. So screenshot from our class. So we had discussed about right side optic nerve lesion. If right side optic nerve is being damaged, on the right side, there is complete blindness. That's called monoocular blindness. Usually this type of lesion is seen in optic nerve lesions. Optic nerve. Yes, no explanation, Malini. I can understand. Only answers, Manoj. Don't worry. Quickly we'll go. Only answers. A patient collapses and loses consciousness. Then he recovers. Diagnosis shows complete heart block. Identify the related disorder. So this you can see in the class notes in the app, where there is a note on the different types of heart blocks. First degree heart block, second degree heart block, and third degree heart block. Third degree heart block or AV block is the worst form. In third degree AV block, there's a complete block between the SA node and the ventricles. So impulses from SA node not able to reach the ventricle. So what will this ventricle do? It will beat on its own because there's a complete block. When the ventricle is beating, heart rate decreases because ventricle can't beat like SA node. It can't produce 100 beats. It can only produce 35 beats. When heart rate decreases, cardiac output decreases, brain blood supply decreases, intermittent fainting, this is called Stokes-Adams syndrome. So complete AV block or heart block is called Stokes-Adams syndrome. Yes, Anshu Anjan, the question was not correctly recalled. Yes, doctor, if you are able to recollect the question, please let me know. So as far as what we have received from the students, I was just able to frame it like this. So if the question was this, complete heart block, then we will go for Stokes-Adams syndrome. Because clearly in Wolff-Parkinson-White syndrome, there's an aberrant connection. So there's an aberrant pathway which will produce very early depolarizations, delta wave, all that is seen in Wolff-Parkinson. So this question, if this is the question, more closely relating to Stokes-Adams syndrome. Magic syndrome, genital ulcers. Okay. So if you're able to get any more clues, please let me know. I'll move on to the next one. Which of the following is a feature of surfactant? So just about the features of surfactant. Surfactant is produced by type 2 pneumocytes, not type 1 pneumocytes. They help to prevent alveoli from collapsing. Yes, this we have discussed in our notes where we learned about, in the class also we learned about compliance. Compliance is determined by surfactant. Surface tension will collapse the alveoli. Surface tension will close the alveoli like this. But what is surfactant doing? It is reducing the surface tension. When you destroy the surface tension, alveoli will not collapse. So this is preventing alveolar collapse. So that is what is surfactant meant for, preventing alveolar collapse. So helps to prevent collapse of the alveoli. Question number 5. Merkel cells, which are mechanoreceptors involved in touch sensation, primarily located in which layer of the epidermis? Yes, this was a very direct question. Merkel cells are seen on stratum basalis layer of the epidermis. Merkel and Meissner are two of the receptors which are seen on the epidermal layer. Ruffini and Pacinian are seen deep inside the dermis. And there was a 6th question on a patient presenting with fatigue and pallor. Laboratory investigations confirm iron deficiency anemia. A defect in which of the following transport protein could be responsible for this? Yes, all of you are almost right. It is transferrin. Amrinder Singh, you're crying because you are exhausted or you did something wrong or you've marked any question wrong. Okay. So this answer would be transferrin, because transferrin is a primary ion transport protein in the plasma. If this is not there, you can't transport iron. So definitely the patient will have iron deficiency anemia. What about the other options? What is ferritin? Ferritin is a iron storage protein. What is transthyretin? We learned this in thyroid hormones. Thyroxine binding protein. It's a thyroid hormone binding protein, not at all related to iron. Hemosiderin. This is an insoluble storage form of iron. So the most likely answer for this would be transferrin, because that is only transporting iron. The primary transport form is along with transferrin. Yes. A 6-year-old child with a known cardiac condition was admitted for management and started on heparin. So the question was on heparin therapy. Within a few hours, he developed gingival bleeding. Laboratory evaluation shows an elevated APTT. What is the most appropriate antidote to reverse the effect of heparin? Yes, what is the answer for this? Okay, Galaxy. The question said which ion transport protein is increased? Increase in which condition, doctor? Yes, the answer for this is yes, protamine sulfate. Protamine sulfate. So let's discuss about all the options that were given. First, the question is about heparin. Heparin, the mechanism of action is it enhances antithrombin 3, prolongs APTT. Protamine sulfate is a specific antidote to heparin. So if the question was on heparin, definitely the antidote is protamine sulfate. What about the other options? Vitamin K. This is not used for heparin toxicity, but it is used for oral anticoagulant, warfarin toxicity. Fresh frozen plasma, it provides clotting factors, but it is not the first line of reversal for heparin. Desmopressin is a vasopressin analog. It is used in von Willebrand disease. Von Willebrand factor deficiency is called von Willebrand disease, for which we can use desmopressin. So here the most likely answer would be protamine sulfate. Yes. Question number 8. Which part of the nephron is responsible for secretion of uromodulin, which is called as a Tan-Hochfall protein? So the answer would be ascending loop of Henle. What is this uromodulin? Uromodulin, this is also called Tan-Hochfall protein. It is the most abundant protein in human urine. It is synthesized and secreted by thick ascending limb of loop of Henle. It has a role in preventing urinary tract infections and also in preventing kidney stone formation. So the answer would be thick ascending limb of loop of Henle. Ninth question. A 50-year-old male presents with complaints of fatigue, numbness in the lower limbs. On examination, anemic, pallor. Echocardiography reveals right ventricular dilatation. So this numbness is a very common symptom. It can happen in cyanocobalamin, B12 deficiency also. But the more specific one here is right ventricular dilatation. Which vitamin deficiency most likely? Thiamine deficiency. because thiamine deficiency can lead to wet very disease, and this can cause cardiovascular symptoms, cardiovascular system related issues. For example, dilated cardiomyopathy is a feature of thiamine deficiency, numbness and fatigue also. So because of the dilated cardiomyopathy, we can choose thiamine here. So otherwise, B12, cyanocobalamin also could be an answer. Since heart-related issues are there, we go with this. Question number 10. Yes, I think most of you have given the right answer only. Good. A patient presents with fluent speech but aphasia characterized by neologisms that don't make sense. Which area of the brain is more likely affected? Yes, what is the answer for this? Very simple question. C, Wernicke's area. We had clearly discussed this. This is a screenshot from our class lectures. So we have discussed about the differences between Wernicke's aphasia and Broca's aphasia. Wernicke's area is area 22. It is located on the superior temporal gyrus. It is a sensory area for speech, helps in comprehension, understanding the meaning. It's called receptive aphasia or sensory aphasia. Comprehension is lost because Wernicke's area, most important function is comprehension, that is lost, but fluency is not lost. So whatever you talk to the patient will understand. The patient will not understand because comprehension is lost. It is a meaningless speech. But since Broca's is fine, he will have a fluent speech. So without meaning, he will keep speaking something. That we call it as neologism. What is neologism? He will create his own new words. That is called neologism. What is jargon aphasia? One severe or the worst form of Wernicke's aphasia is jargon aphasia. So this neologism is very specific for Wernicke's aphasia. Yes. What about Broca's aphasia? Damage to area 44 on the inferior frontal gyrus. Broca's area, this is the motor area for speech, helps in producing motor speech. It's called expressive aphasia or motor aphasia. Here, comprehension is not lost. Yes, because Wernicke's is fine, but fluency will be lost. So this is called meaningful but non-fluent speech. So that's the difference between Wernicke's and Broca's. This is a very repeatedly asked question. Yes, in rapid revision. Rapid revision also we saw this table. So very important topic. Every year we can see questions on Wernicke's and Broca's. So the answer to this would be Wernicke's aphasia. What about the other options? What is Broca's aphasia? Yes, Broca's is responsible for fluency. So fluency will be lost. What about angular gyrus? Angular gyrus has two functions: naming objects and reading from printed material. So if angular gyrus is lost, that's called anomic aphasia. You will not be able to name the objects, not able to read from printed material. That's called dyslexia or alexia. Arcuate fasciculus. This is the conducting fiber between Wernicke and Broca's. So if there's any damage to the arcuate fasciculus, the conducting fibers are damaged. This is called conducting aphasia. And the 11th question, a 22-year-old healthy patient is enrolled for a drug trial evaluating renal perfusion. The drug causes increase in GFR and filtration fraction. Which of these is the mechanism of action of the drug? So this question is about understanding the concept of filtration fraction. Yes, which was the answer that you gave for this? What was the answer that you gave? A, B, C, or D for this question? It's a bit confusing question. What was the answer that you gave? Okay, so right answer here is C, efferent arteriolar constriction. If this was the question, then this C would be the answer because the question is about filtration fraction. Filtration fraction is equal to GFR divided by renal plasma flow. So if there is any drug which will increase the GFR and will decrease the renal plasma flow, GFR numerator is increasing, but denominator, renal plasma flow is decreasing. If numerator is increasing and denominator is decreasing, then filtration fraction will increase. So two features, increase in GFR and increase in filtration fraction. So only you can have an increase in filtration fraction only if numerator is increasing and denominator is decreasing. So these three criteria should fit in there. So we'll see for which of the option these three criteria are fitting in correctly. First option, afferent arteriolar constriction. When there is afferent arteriolar constriction, afferent arteriole is the one which brings the blood into the glomerulus. If this one is going for constriction, then there is less blood reaching the glomerulus. GFR also will decrease. So afferent arteriolar constriction, there's no blood, so filtration also decreases. GFR decreases. The second one, afferent arteriole dilatation. If this afferent arteriole dilates, more blood goes into the glomerulus, more is getting filtered. So GFR increases. Afferent arteriole dilation will increase the GFR. If afferent arteriole dilates, the plasma flow also will increase. So there's an increase in renal plasma flow. GFR, renal plasma flow, both are increasing. If both are increasing, ratio will not change. What is the ratio? Filtration fraction. Filtration fraction will not change. So filtration fraction will remain same here. So in afferent arteriole dilation, numerator, denominator, both are increasing. So filtration fraction remains same. Efferent arteriolar constriction. Efferent is the one which brings the blood out of the glomerulus. If this one is going for vasoconstriction, all the blood that flows into the glomerulus will stay back in the glomerulus and increase the GFR. Yes, more the blood stays in the glomerulus, more the filtration. But what will happen to renal plasma flow? If you constrict the efferent arteriole, the plasma flow is decreasing. So this will increase the GFR, but decrease the renal plasma flow. Numerator is increasing, denominator is decreasing. So filtration fraction will increase. Efferent arteriolar dilation. If the efferent arteriole dilates, all the blood that flows here will flow out of the efferent, dilated efferent. So blood is not staying back for filtration. When blood is not staying back for filtration, GFR will decrease. So there's a decrease in the GFR. So most likely we can go with option C, where there is efferent arteriole constriction, increase in numerator, decrease in denominator. So when there's an increase in the numerator and decrease in the denominator, filtration fraction increases. Yes, any doubt in this question? Okay, so many discussions are going on the results. Yes. Yes, Dr. A, but if we have to go for one option, we'll go for efferent arteriolar constriction. Because increase in GFR and decrease in renal plasma flow does not fit into any other option. At least in efferent arteriolar constriction, so initially we have an increase, later we'll have a decrease, but initially we are having an increase. So when you take this value of renal plasma flow, which is not fitting into any other option, so we'll go for C. Yes, you're right. Initially it is different, later it is different, but of the 4 options given, the best one you can choose is option C, because anyway, initially there's an increase in GFR. Yes. So this was the concept that we had discussed in our classes. The efferent arteriole constriction, initially it will increase GFR, later on it will decrease the GFR. So initially, since it's increasing the GFR and the plasma flow is decreasing, we go for the option C. Mahi and Swati, you want me to go slow? Okay, because you asked me to go fast, I was going fast, but if you want me to go slow, okay, this question, again, you want the explanation for this question. Okay, please listen. Since students are asking for the explanation for this question, again, quickly I'll repeat this. See, look at the question. Drug causes increase in GFR and filtration fraction. So there is an increase in GFR and increase in filtration fraction. We should see of the 4 options, which is the one which best fits into this. What is the formula for filtration fraction? Filtration fraction is equal to GFR by renal plasma flow. Out of the total renal plasma flow, what fraction is getting filtered? So GFR by renal plasma flow. So when will you have an increase in filtration fraction? If the numerator is increasing and denominator is decreasing. Numerator should increase, denominator should decrease. Only then the fraction can increase. So whenever there is an increase in GFR and decrease in renal plasma flow, filtration fraction increases. So of the 4 options, we're just trying to fit the one which has increase in GFR, increase in filtration fraction, and decrease in renal plasma flow. Afferent arteriole constriction. Afferent arteriole means the blood vessel which brings in blood into the glomerulus. If this one goes for constriction, there's no blood flowing into the glomerulus. If there is no blood flowing into the glomerulus, this will decrease the GFR. Filtration will decrease. So afferent arteriole constriction will decrease the GFR. Afferent arteriole dilation. If this one is dilating, more blood flows into the glomerulus. More the blood flows, more is the GFR, and more is the plasma flow also. So numerator, denominator, both are increasing. Therefore, filtration fraction will remain the same. Option C, efferent arteriolar constriction. Efferent is the one which is bringing the blood out of the glomerulus. If this one goes for constriction, then the blood is not able to flow out of the efferent arteriole. So therefore, it stays back here, increasing the hydrostatic pressure and therefore increasing GFR. So this increases GFR. But since efferent is constricted, the plasma flow is being affected. So renal plasma flow decreases. Numerator increases, denominator decreases. Therefore, filtration fraction increases. And that's why we go with this option. Yes. So with that, we complete our discussion on physiology. Yes, please go fast, please go slow. Explain all question again. Yes, anyways, you can watch this video anytime you want. I'm just seeing if there are any other queries there. Okay. So thank you so much for joining me with this session. I think all of you are very tired and exhausted. So let me end this session with this. And thank you so much for joining with me. So one thing I can tell you is you have done your best. You leave the rest to the God. He will take care of it. And all the best for your results, guys. Thank you so much. So this will be followed by our next faculty. Thank you.
Very good evening, students. I hope your exam went off really well. And I was very happy to see the question papers. 1 second. Huh? Okay. So I'll keep seeing your doubts in case it keeps coming in. Okay. So basically, yeah. So I'm very happy with the question paper, and I'm very happy to see that you all have been able to answer the questions, and that brings in the biggest satisfaction for us teachers, for you all. Okay. So let's quickly begin with our session for today. Okay. So these are the topics which were circulated with you all, which is the most important questions that can come as NEET MDS, right? So again, after we complete all the questions, we'll go back and see what all was covered and what are if the questions were from these categories or not. Okay. So I had suggested that the important questions that you cater to would be from epidemiology, okay, biostatistics, screening, concept of health, important notes as factual. Questions will be covered in test and discussion and revision videos, okay? So basically, coming to the first question. All right. So the first question was that the CPI-TN probe force, okay, with what force should you use the CPI-TN probe, okay? And the options were not exceeding 10 grams, not exceeding 20, not exceeding 30, not exceeding 20. So according to you all, what should be the answer? All right. So the answer, as you all have correctly marked, should be not exceeding 20 grams, right? Now, we had covered this in your recorded classes, in your live classes,
and as well as your revision videos for index. Okay. So what we had told here that, see, this is the screenshot of your classes where the force should be 20 grams. And how do we evaluate that whether the pressure that we are applying is right or not? So we insert the probe in the thumbnail very gently to see if the amount of pressure is right. That is how we evaluate. That is how we basically assess that the pressure applied is right or not. Also, as we had told in the class, that when we examine in case of a CPITN index, we walk the probe. So the pressure should not be more than 20 grams, otherwise it will be painful to the patient. Okay. So again, the answer here would be it should not exceed 20. Okay. I hope this question is clear. This question was from the topic index. Okay. Which was covered and here. This is the topic, right? Indices. Then next we go to the second question, which is a variant for t-test in a paired data. Okay. Now again, you all have answered this correctly. I was reading some discussion in one of your groups where you were confused between McNemer test and Wilcoxon sign test. We're not exactly sure of all the options, but I think this is what we could recall correctly. So again, we go back to the basics. The basics say that there are two types of test, all right? One is a parametric type of a test, and the other test is non-parametric. Okay, these are the two types of tests that we have studied in the test of significance. Okay, now what is a parametric test? A parametric test is which follows the normal curve. Okay, normal curve as in we have read about the Gaussian distribution wherein it follows the normal curve. Non-parametric test is in which the distribution is not normally distributed. Okay, the entries are not normally distributed. Okay, so now as we know that which is a parametric test are paired t-test. Okay, paired t-test is a type of a parametric test. Okay, now what does parametric test do? It measures the observations which come in pairs. Okay, for example, if you want to measure observation or if you want to measure the blood pressure of a patient, okay, so you want to compare the readings. Okay, you want to compare the blood pressure of a patient before taking a particular drug, all right, which is before and after. Okay, you took a drug. Okay, so in order to compare these two observations, the test that we use is called as the pair t-test. Okay, measurement of BP before taking a drug and after taking a drug. That will be that is where you use the pair t-test. Okay, now what you need to know and what you all already know is that t-test is something which measures quantitative data. Okay, what does t-test measure? It measures the quantitative data. What is a quantitative data? Quantitative data is numerical data, wherein the observations are in numbers. Okay, for example, before taking the drug, the BP was 120. Okay, after taking it was 100. So here the observations are in numbers. Okay, so the pair t-test measures the quantitative numerical data, which is in the form of numbers. Okay, so what you need to do and remember is that the Wilcoxon sign test, which will be the correct answer in this case, Wilcoxon sign test is what measures the quantitative data as well. However, Wilcoxon sign test is a non-parametric test. So if we have to apply a non-parametric test as a replacement for a paired t-test, we will replace it with a non-parametric test. Now, again, the question comes that why not a McNemer test? Okay. Now, what the McNemer test does is that it measures the qualitative entries. Okay, what are qualitative entries? Qualitative entries are non-numerical entries in categories. What are those categories? Such as you label it as mild, moderate, severe, okay, tall, short. So this is what the McNemer does, okay? However, if in your options Wilcoxon sign test is not given, then you can go for McNemer test. If Wilcoxon sign test and McNemer is given, then of course, because Wilcoxon sign test also measures the quantitative entries, just like your paired t-test, you will mark the answer as the Wilcoxon sign test, okay? Because McNemer measures the qualitative data. So this was covered in your Revision Pro. Okay, this is a screenshot of your revision videos where we had put it in the form of a table so that you can revise easily. The paired t-test, the equivalent for paired t-test will be your Wilcoxon sign test. Okay. Coming to the next question, which is, so again, this is a topic. The second question is from biostatistics. Okay. We have a question from indices. We have a question from biostatistics. All right. Now coming to the next question here. All right. This is also one of the queries that a student had asked that, what is McNemer? So I had explained that McNemer measures binomial outcomes, okay? But treated, non-treated. What is this? This is like chi-square. Chi-square measures qualitative data. Here I've mentioned, okay? Chi-square measures qualitative data. So McNemer, we apply for paired data of nominal qualitative data, okay? It can be applied only on two groups with two outcomes. So this is where it is mentioned in your query sessions that McNemer measures binomial, okay, two entries, that means qualitative data, okay. All right. Now let's go to the next question. The next question says that what are the 5 A's in tobacco cessation counseling? Okay. Now, first of all, what are the 5 A's and what is tobacco cessation counseling? So whenever we counsel a patient to quit tobacco, okay, we have various approaches, okay. The one approach is a regulatory approach. What is a regulatory approach? Regulatory approach says that, you pass the acts, such as cigarette smoking cannot be done in public places, okay. Then there is service approach. Service approach is where you examine the patients, make them aware of the signs and symptoms. The next approach is an educational approach, which is the most effective approach in all cases, okay. What happens in the educational approach is that you educate the patient on how they can quit and make them competent enough to help them quit the tobacco, okay. So what are the 5 A's? This is covered in your recorded lectures, which is epidemiology of oral cancer. Okay, so then what are the 5 A's? And I'll explain why this sequence is correct and which sequence is correct. Obviously, when you want to educate a patient on tobacco cessation, okay, the right answer will be, first is you ask, okay. When a patient walks in, you ask the patient that, are you willing to quit tobacco? Then are there, ask for the signs and symptoms. Are stains present in the oral cavity? Okay. Check for signs of halitosis. Any false odor is present. Okay. Any lesions are present. So first is you ask the patient. Okay. Then the second step will be you advise the patient. What do you do? Like, just take it. You don't have to mug this up. Obviously, it is very simple that first the patient will come to you, you'll ask, okay, you'll assess for the signs and symptoms. Okay, the next is advice. How do you advise? You advise the patient that what are the harmful effects of tobacco according to their various age groups. Okay, for example, someone who's a younger patient. So we tell that patient that, your aesthetics will be compromised because that is of concern to them. Okay, someone who's a laborer, for him, the finances are very important. So we tell them how much money do you spend on, each cigarette, what is your monthly expense. So we advise them accordingly. We tell them how on a patient who's well off, we tell them how it can cause cardiovascular diseases, someone in a middle-aged category. Okay, so you advise a patient. Now, someone who's telling that that person is not taking tobacco, you congratulate that person. You have to encourage that you're doing a good thing by not consuming tobacco. Okay, so this is the second step, which is advice. The third is you've already advised. Now you assess. Okay, how do you assess? There are two ways to assess. One is you assess that how much dependent a person is on that particular habit. Okay, now I had taught you this phlogistrome test. Okay, what is a phlogistrome test? This is a scale. It has various categories. And the first question is that, when do you need your tobacco? If the patient says within 30 minutes of waking up, so that is a very severe level of addiction. So you assess that, how much addicted a person is. Okay. You also assess the risk of relapse, that in this particular case, how likely is a relapse, that how likely is he bound to go back to consuming tobacco after he's left it. Okay. That is the next step, which is assess. Okay, then the next step is, once you've assessed that how dependent a person is based on his levels of dependency. Okay, if the person is, you will assess that how much nicotine replacement therapy, those tablets you would have seen. So we assist the patient, okay, in quitting it. How? By giving him nicotine replacement therapy. Based on his level of addiction, we will give him nicotine replacement therapy. Okay, and then the next step is, once you've assisted him, again, the follow-up is very important. So you have to arrange for a follow-up so that the patient can come back and you can follow up based on the number of visits. Okay. So these are the various steps, which is ask, advise, assess, assist, and arrange. Okay. These are the various steps. All right. So this was, again, as I told you, we had taught you in the epidemiology of oral cancer. Okay. Then the next question which was asked is that which is a bias that occurs due to differences in admission rates. Okay. What I'm very happy to know that all our DBMCI students have answered this question correctly. So the bias that occurs due to difference in admission rates will be Bergsonian bias. Okay. The reason why it is called as a Bergsonian bias is because this was given by Dr. Joseph Bergson. So this was named after Dr. Joseph Bergson, and basically it is also called as, like as has been covered in your recorded live and revision, that this is called as a Bergsonian or a admission rate bias. Okay. Now, why it is a bias and why it is a admission rate bias? Okay. Now, basically, first of all, let's understand what is a bias. Whenever we do an epidemiological study, okay, we calculate the association, okay, that the exposure. What is the exposure here? Suppose exposure is smoking, okay. We want to calculate the association between exposure and outcome. What is the outcome? Outcome, suppose we want to measure that how is smoking associated with cancer, okay. Now, if in this measurement, if there is an error, okay, in the determination of this association, that error is called as a bias. Okay. So now basically what happens that when we take patients who are in the hospital, okay, so now there is a difference in the admission. Okay. Also what happens is that the mild cases, they improve and the severe cases, they die. So there is a selective survival amongst the cases which are prevalent. Okay. So now this American statistician named Dr. Joseph Bergson, he came out with this concept, and he explained what this Bergsonian bias or bias due to hospital rate admission is. Okay, because there are different rates of admission in the hospital. The types of cases are different, which could be severe cases or complicated cases. Okay, and this is a type of bias which is related to our selection of cases. Okay, with the cases and controls that we are selecting, which are hospital based. So this bias is basically a Bergsonian bias due to a difference in the admission rate. Okay, this is again the screenshot of the class in which it was covered for you all. Okay, now the next question is a targeted method of monitoring specific health conditions. Okay, we have to pay a lot of attention to the language of the question. Okay, so this is basically specific health conditions in selected group of people. Okay, what kind of surveillance would that be? Okay, so this was covered in your classes, which is your recorded classes, your live classes, as well as your revision pro. This is sentinel surveillance, and we had told specifically that this is a specific disease monitoring, which is the exact language which is being asked. Okay, so now what is sentinel surveillance? Okay, there are two types of surveillance. That is, surveillances where we are detecting the prevalence of diseases. Okay, one is sentinel surveillance, and the other, which is the normal method, which is the passive surveillance. Okay, so now what happens in sentinel surveillance is that we employ a voluntary network of doctors. Okay, those doctors are there who monitor the rate of occurrence. So, unlike the normal procedure, these doctors present in the community, they monitor the rate of occurrence of the particular diseases in a particular area. Okay, so there is a special focus and involvement of these network of doctors. Okay, and what they monitor is that at which rate that particular disease is increasing. What are the trends in the population? That is this particular disease is increasing, it is coming down, there is a seasonal trend. Okay, and if there is an outbreak of a particular disease, if a particular disease burden is suddenly increasing. Okay, so this is how they do it in a sentinel surveillance. They take the primary data, and then that data is multiplied to be covered for the entire population. Okay, so it is extrapolated. Okay, whereas in a passive surveillances, these are the standard reports. They receive the data from everyone. But in sentinel surveillance, the specific health condition of a selected group is taken by this particular doctors. Okay, so this is what is the answer here will be sentinel surveillance. I hope you've marked the answers in all. Yeah, here the answer will be A. Okay, here the answer will be Wilcoxon signed test. Here the answer will be 20 grams. So again, this sentinel surveillance question was from this topic that we had emphasized, that is concept of health. Okay, this was also there, concept of health. Okay, now coming to the next question, which is mean plus minus standard, two standard deviations. All of you answered this very correctly because we have revised this many times, and you've all answered this nicely in the GTs that you've attempted, the tests that you've attempted. So this is the standard normal curve has been taught to you all, and we all are aware that mean plus minus two standard deviation covers 95% of the population. Okay, because what we've studied in our normal curve is mean plus minus one standard deviation amounts to 68%. We've done the calculations also, so many numericals we solved, and you all were very happy that no numericals were asked, no calculations were asked. Okay, so we used to put in the formula, right, of standard deviation, mean, and calculate. Okay, so mean plus minus two standard deviation will be 95%, and mean plus minus three standard deviation will cover 99% of the population interval. Okay, so we are clear about this. Again, this is a question from biostatistics. Okay, this is a question from your biostatistics. Okay, as emphasized. All right. Now let's come to the next question, which is, which of the following is a type of experimental research? Okay, so now there's a lot of confusion in this question because like one version of the question that we received is that experimental data in public health is equivalent to. So we don't know that what are the options if this is a type of experimental research which was asked, or it was the experimental data in public health which is equivalent to ask. However, if this is the question which is asked, then the options are definitely incorrect because as we all have studied, okay, in your classes, in your notes, and in your revision, that epidemiology is categorized into two categories: observational, okay, and experimental and interventional, okay. Observational studies are of two types: descriptive and analytical, okay. Analytical studies are of four types: cross-sectional, ecological, case control study, and cohort study, okay. Whereas your some of you also said that one of the options is ecological, which again is not a type of an experimental study, okay. Experimental studies, if your three options, if any of these three options would be present, such as clinical trial, field trial, community trial, then the answer would be one of these, okay. Now, given the options that we have, data trends, okay. Now it can't be data trends. Why it can't be data trends? Because what is data trend? Okay, data trend is not a type of a study. It is basically we are observing the trends in data, okay, which also is done in a descriptive study or an observational study. It is not done in an experimental study, because what is an experimental study? It is an interventional study wherein we give an intervention, okay, suppose administering a drug, administering a type of a mouthwash. So this is definitely not data trend. What is a systematic review? Again, why it can't be systematic review? Because systematic review is not experimental. It is a secondary research wherein you are collecting the articles, compiling them, and analyzing that. So that is systematic review. So it can't be systematic review. The third is documentation. Now, we all understand what is documentation. It is recording the information and reporting the information. Okay, that is, so it can't be documentation. It is not an experimental study. The next is, if it is clinical trial, then this is definitely the answer. Okay, one of the options someone told me was analysis. Okay, and what is analysis? Analysis is a procedure, okay, wherein all types of researches are analyzed. So it is not analysis also, okay. So we'll get to know what the complete question is, then we'll understand it better and we'll come back to this question and revise, okay. So coming to the next question, which is barefoot doctors, okay, is an example of. So we covered this in primary health care, okay. This is a screenshot of DBMCI notes of mine. So this is basically in China. This is, what is the chapter? Primary health care, okay. Primary health care has basically 5 principles as we studied, okay. What is primary health care? Primary health care means providing essential health care, okay. That is your basic health care, which is accessible to everyone. Everyone can access the healthcare, whether that person is staying far away, staying near, okay, and it is affordable, okay. A rich person and a poor person, they all can access that healthcare. That is called as the primary health care, okay. So how do we ensure that people attain primary health care? One of the principles is, the first one is equitable distribution. Whether a person is rich or poor, that person will get the primary health care. The question was asked is that barefoot doctors is a type of what principle? It will be an example of the second principle, which is community participation. Why community participation? What do we do in community participation is that we take the people from the community itself, okay? People who are representatives of that particular community, we take them and we educate them in order to spread necessary information on hygiene, on vaccinations, on family planning. So this concept was used by China, and those people were called as barefoot doctors. Why they were called barefoot doctors? Because they used to work barefoot in the rice fields also, and they used to spread the information also. Okay, so basically in community participation is these are the people who act as a bridge so that the challenges are overcome. Okay, and in India, what had we studied? Who are these people who bridge the gaps? They are the village health guides. They are the DAIs who do the deliveries, the ASHA workers who spread the message on nutrition, on, so that the maternal mortality rate is not very high. Okay, so they ensure that the mother is given the proper nutrition. The DAIs help in conducting the deliveries in a sterilization manner. Okay, so that the infection is not there. So in India, those representatives are village health guides, Anganwadi workers, ASHA workers, DAIs. Last year, a question was asked on the Anganwadi workers. Okay, this year they have asked on the barefoot doctors. So in China, these people were the barefoot doctors. Okay, these are basically the healthcare providers who have received the basic medical training, and they are working in villages promoting hygiene and the family planning. Okay, and they treat the common illnesses and they refer the complicated cases to the hospital. Okay, now how this concept of barefoot came in, because these were the southern farmers used to work in the rice paddies while also practicing medicine. Okay, so I hope we'll not forget this. All right. Now the next question is basically from fluoride. Fluoride this year is taken by Pedo, Dr. Anaya. Okay. So basically this said that the Galgon and the Young's empirical formula for fluoride is based on body weight and, okay. What is this formula basically? So this Galgon's and Young's empirical formula is also called as the Dean's formula. So we had various options such as age, height, climatic condition, and vitals. Okay. Now, what is this formula? This formula is basically used to calculate the optimum fluoride level. Okay. In your drinking water, what should be the optimum level of fluoride? Okay. How much fluoride should be present? So how do we calculate this? We calculate this with the formula which is called as 0.34 divided by E. Okay. What is E here? E here is the average daily temperature. Okay. This is the average daily temperature. Okay. So this is definitely based on the climatic conditions. Okay. Now this formula helps determine the optimum fluoride level in drinking water based on because this is the daily temperature, so it is based on the climatic condition. So the right answer would be C, which is climatic conditions. Okay. Coming to the next question, which is a quantitative discrete type of a data. Okay. Now, what had we studied in our notes? Okay. We had studied the discrete data, continuous data, and the types of data. Okay. So basically, we have two types of data. Okay. As we had studied, one is a qualitative data. Okay. And the other type is a quantitative data. Okay. So quantitative data is something which is based on the numbers. Okay. This is numerical, numbers in nature. Okay. For example, if we say that the height is 167 centimeters, that will be quantitative. If we say that the person is tall or short, this will be qualitative data. Okay, so qualitative data is in the form of categories, okay, as we read, okay, mild, moderate, severe. A type of a blood group will be a qualitative data. It is A, B, that is not a number format, okay. Qualitative data will be of two types, ordinal and nominal, okay. Whereas quantitative data is of two types. One is discrete and the other one is continuous. Okay. So basically, what is discrete and what is continuous and what is asked here? The answer, the question here is it should be quantitative, numerical, and it should be discrete data. So how do we demarcate that out of these options, what is discrete, discrete and what is quantitative? Okay. So discrete data has whole numbers, okay? Whereas continuous data is continuously varying, as was taught to you all. For example, the temperature is constantly varying, the age, okay? These are continuously varying. The discrete data in our given options, okay? What would the discrete data be? DMFT, whole number, DMFT score of 3. There was one question in pedo also, right? 3 score, 4 score. Okay, age 12 years. So this is all, age is basically continuously varying. It is continuous in nature. Discrete is DMFT, okay? Also BP is something which is in whole numbers. It is not in the numerical form. But out of all these options, if you have to choose, then the most appropriate answer would be DMFT, because we had already read that temperature, okay, weight, height, all these are continuous data. What was asked is discrete data and continuous in nature. Okay, so as we know that all our important questions were covered from these headings, okay, which is your important PhD topics, which was told, okay, which is concept of health, biostatistics, epidemiology, indices, okay. So, I hope you all ace with flying colors. And now Dr. Himani will be taking your session on the important questions and the controversial questions and on the exam pattern. So thank you, students.
Okay, good evening, friends. In this last session for today, we are going to discuss one or two controversial questions which have always created a rift between students, a rift among faculties. And we will discuss these questions today, and we will know how you have to decide before the exam what answer you want to mark. Okay, like first question is, which of these is used as a dilating instrument in forceps extraction? This is not a controversial question. Okay, this is a question which is taken for example. Okay, this is actually not something which we read routinely. Okay, it was a difficult question because this is not something which we read in routine dentistry. A specific textbook of oral surgery which usually is read in post graduation is Jeffrey Ho. All right. And in Jeffrey Ho, there is a direct line from the textbook from which this question is made, that when you hold the tooth with the forceps and you use the tooth to, you luxate the tooth, you use the tooth as the dilating instrument to expand the socket. Okay. This is actually a direct pick from this textbook called the Jeffrey Ho. Okay. The lines say that expansion of bony socket to permit the removal of its contained tooth. This is achieved by using the tooth as a dilating instrument and is the most important factor in forceps extraction. It comes with a diagram, and if we go by this, the direct pick of lines of the textbook, then the correct answer for this question is not the beak of forceps, which looks like the correct answer in first go, The correct answer is the tooth itself, which is used as a dilating instrument. Similarly, one more question which has always bogged up the minds of students and faculties alike is the effect of lignocaine toxicity on CNS. Okay, now again, we don't know what key or what thinking process the examiner has in mind. Okay, because it all looks like a word play. Okay, it all looks like a word play. CNS depression only, initial depression followed by stimulation, initial excitation followed by CNS depression, and CNS excitation only. Now, there is a controversy between option A and option C. We know that when the lignocaine toxicity happens, initially it happens that it causes seizures, it causes tremors, it causes excitatory behavior, it causes seizures, and in end it causes a coma and death. Some people consider seizures and tremors as a part of CNS excitation. Why? Because it is basically the inhibitory neurons of the CNS which are blocked by the lignocaine. The sodium channels which are blocked by lignocaine causes inhibition of the excitatory neurons, okay, which causes the excitatory effects. Some books, like the standard books of Malamud, suggest that although the expression of CNS depression is tremors and seizures, but actually the effect is CNS depression only. All right, so this is a controversy. So honestly, we use lignocaine as a local anesthetic agent. The dose in which we use lignocaine as a local anesthetic agent is too low. It is too low to cause absorption into the systemic circulation and cause CNS toxicity of the level of tremors and seizures and coma. Lignocaine, when used as an anti-arrhythmic agent, okay, we all know that ventricular tachyarrhythmia is one of the important indication of plain 2% lignocaine. When it is used as an anti-arrhythmic agent, that is the point when we have to titrate its dose to make sure that the effect is not going towards tremors and seizures. All right, that is where when you have to actually titrate the effect. Again, coming back to the textbook lines, this is direct lines from the 4th edition of Malamud, along with the diagram which is there in the textbook. Now, these lines suggest that the pharmacological action, their pharmacological action on CNS is depression. Okay, just like the previous question where it is a direct pick from the textbook. Okay, again, this line is a direct pick from the textbook, which states that local anesthetics readily cross the blood-brain barrier. Their pharmacological action on CNS is depression. Okay, this is the direct lines picked up from Malamud. So if we go by these lines, the answer would be CNS depression only. Okay. The diagram which is there in the textbook also suggests the same thing, that at a dose of 0.5 up to 4, okay, the effects are anticonvulsant effects. When the dose crosses 4.5 to 7, again, the effect which is mentioned here is CNS depression. The expression of this CNS depression is tremors and seizures. Beyond this dose, when you go even for a further toxic dose, 7.5 to 10, again, the effect which is given is CNS depression only, which is manifested as seizures and later on as generalized CNS depression. Okay, so if you go by Malamud, at all levels, the clinical manifestation of the drug may be toxicity of the drug, may be tremors, maybe seizures, maybe hyperexcitable behavior like excessive talking and all those things. But the effect is CNS depression only. However, the explanation that we have given in the app, we have followed the controversy, we have discussed it between pharmacology textbooks, we have discussed it between general anesthesia textbooks and the Malamud, which is a local oral surgery, local anesthesia textbook. All right. And the conclusion what we drew is already, it is there in the app. The conclusion which we felt is absolutely correct is systemic toxicity of LA is described as convulsion followed by depression. Okay, there is initial convulsion, which some people feel is an excitatory behavior because it inhibits the inhibitory neurons of the CNS. Okay, examiner this time has not put the same language. He has put the language of initial excitation. Is it CNS excitation or is it behavioral excitation? You can't say, because yes, there will be CNS excitation, correct, because the inhibitory neurons are inhibited. So only the excitatory neurons are firing, which is causing the seizure, which is causing the tremor, which is causing coma. But would you call it a CNS excitation or would you call it a general excitation followed by depression? So again, this has created a little controversy. We will go by the same answer which we have given in the app, convulsion followed by depression. And the explanation also clearly states exactly what we are saying. The effect of lignocaine toxicity on CNS is always depression. This is direct lines from Malamud. But what happens is it's a stepwise phenomenon. Initially, the inhibitory neurons of CNS are more susceptible to the to lignocaine. Okay, so initial LA toxicity and hypoxia causes the excitatory manifestations due to inhibition of the inhibitory neurons. This excitation is responsible for the excitatory behavior and convulsions. Okay, so whether you will call it excitation or whether you will call it a CNS depression causing excitatory behavior, we are not sure what the examiner is actually wanting to ask. Okay, so we are split between Malamud and the pharmacology and anesthesia textbooks. Now it is your call. Okay, I have personally marked it as CNS depression only because it is the depressive action of lignocaine on the inhibitory neurons. It is the depressive action of lignocaine on the excitatory neurons. Okay, manifestation of the same can be excitation followed by depression. Okay, so yes, C is absolutely correct. You are okay, I mean you are right in a way if you have marked C. Okay, you are also right according to Malamud if you have marked A. All right, so the ball is in your court, guys. I don't know what is the correct absolute answer for this question. We have quoted both Malamud and the pharmacology books where the effects are more considered in consideration to lignocaine being used as an anti-arrhythmic agent. Okay, if the language of the question would have been convulsion followed by depression, that would have been absolutely correct. That would have been the absolutely correct option. But the language of the question, unfortunately, is CNS depression only. So, has the examiner taken up the direct lines from Malamud, which says CNS depression, that the pharmacological action is CNS depression, or is he talking clinically that initially there will be excitatory behavior like tremors and seizures, followed by a generalized CNS depression? So, you can take your call. You can just keep your fingers crossed and think that whatever answer you have marked comes to be in the key as the right answer. All right, so these are the two controversial questions. A lot of you have been messaging me. Like I have told, this is the most asked doubt in oral surgery. And all around the year, we've been trying to figure out, we've been trying to understand, and we always hope that in the exam, the examiner makes the options in such a way that the choice becomes clear. Okay, but unfortunately, this time also, the examiner has put the options in such a way that the choice is not clear. Okay, so these are the two questions. This is a straightforward pick from Jeffrey Ho. The tooth, although it's not an instrument, but yes, when you use the tooth in expanding the socket, you're actually using it as a dilating instrument. I'm very thankful to Prapti here, Prapti, who's brought this into notice. And thank you so much, Prapti. This is one question in oral surgery which was discussed. And in the end, I know you guys are tired, which is why we will take the pathomicrobiology session tomorrow. All the subjects have been covered in detail, as much detail as possible by the DBMCI faculties. If you have a genuine feedback, feel free to connect with me on Telegram, on Instagram, on Facebook, on YouTube, on WhatsApp. You have the connect. Whatever is your feedback, good, bad, just let us know so that it will help us do better for your juniors in the future. A lot of you were anxious and you were asking us why we are discussing the questions in so much depth, why we are not just telling you the answer and getting over with it. I can totally understand the anxiety you guys are having. I can totally understand when an answer comes to be wrong, you are irritated, you're not happy basically, okay? But just understand the fact that this video or these videos or these discussions are going to stay there for one whole year or even beyond. And a lot of your juniors, your colleagues who will be giving the exam, maybe you who will be giving the exam again next year, will be using these videos. So it was our duty that we don't just tell you the answer, but we give you standard references. We give you references from the notes, which are prepared from standard books and standard references, so that the answers are not just given to you, just thrown on you. They are discussed with you. All right. So that is the purpose of discussion. I know a lot of you are worried after this discussion that what will be your rank, what will be your score. I don't think you should think so much. Just relax. And all those who are giving INI-CT, you want a strategy. Tomorrow we will come with a definitive, proper day-by-day plan for the INI-CT May. All I can tell you today is two things. Okay. First is no more GTs. Okay. We have only 25 days left. We have only 25 days left, and I don't want to give you any palpitation, any anxiety by giving multiple GTs at all the point. We have already done 4 INI GTs before. You can just take the All India mock, which is the INI pattern All India mock, okay, and 4 sections, and just like that, what we are having every time, 45 minutes, 50 questions, the same pattern which is there in INI every time. So All India mock. Second thing, tonight, before you sleep, okay, most of you have given NEET, those who will be giving INI. Before you sleep, just understand and ask yourself which subjects were strong. Okay, you have prepared, you have read almost all subjects. I'm sure most of you have read all the subjects. Just ask yourself after this recall, what subjects came out to be strong subjects? You felt that it was difficult, but it came out to be, I mean, you were able to solve questions, you were able to get the correct answers. So ask yourself, what were your strong subjects? Okay, and tomorrow we will discuss about these strong subjects, how you have to utilize your 25 days, split your day into morning and evening, how in one section you have to do theory, and in the other section you have to do only and only PYQs of INI-CET only, how you can utilize your SR questions, what is the problem with doing SR questions, everything we will discuss in a detailed strategy tomorrow, which will be available to all of you. Okay, so tonight just relax. A big exam is over. Whatever your score comes out to be, whatever your, whether your 5 questions are wrong or 10 questions are wrong or 50 questions are wrong, your rank will be in proportion to the hard work that you have done. Okay, so don't worry about right and wrong questions at this point. Just remember, जैसे कर्म किए हैं वैसे ही फल मिलेंगे. All right, and you're all in the same boat. Just relax, sleep well tonight. Tomorrow we will have the patho micro recall and the INI strategy. Good night to all of you. Thank you so much for being with us throughout the day, throughout yesterday half day and today. It needs a lot of courage to sit through the whole recall and look at your answers. So congratulations once again to all of you. Good night. See you tomorrow.